component that the student nowadays, the students and teachers are feeling little hesitation to go for research direction. My dear scholars and faculty members, the quality of the research scholar is very, very, very important. That's why, because the UGC wanted to have a best quality faculty members and the scholars to publish quality articles. We are having the risk factor of publishing the articles in a correct path. That is also issue. That's why we are conducting this program. And Manimegalai, we are aware of all the things, how difficulties we are facing to publishing the articles and also going for research project is a difficult task. That applying itself is a difficult task and getting the project itself is a difficult task. And very, very, very fortunate to have such a straight competent project in our university, because we are concentrating in multi-dimensional direction, not only the faculty improvement, not only the student improvement, not only that the community. Also, we are concentrating to applying this basic research into the action research. That is the major aim of doing this tried component one. So, this is the thing I wanted to say. And you must aware the quality of the research scholar is very, very, very important. You must be a curiosity in doing the research. You have an imagination, honesty, carefulness, powers of observation, knowledge of strategy. These are the things you have to have it. While you are entering into the faculty or enter into the scholar, you must be very careful. Your qualities must be developed. You have to enhance your quality. You have to enhance your attitude. You have to enhance your research mobility. That is the way we have to concentrate. Not only doing that, selecting the topic and going for research is nothing. But you have to concentrate fully your research work. You have to aim fully. You have to frame the objectives in a correct manner. You have to execute your project and you have to analyze. That is very, very important. What are the characteristics of the research scholar is also very, very important. Not only qualities, that characteristics. Ability to speak. It is a major aspect we are coming to town. Ability to write. Ability to withstand, ability to understand, ability to coordinate, cooperate, apply, implement, analyze the work. That is the major characteristics of a research scholar. That is also very, very important. You have to develop your attitude and you have to develop your capacity to work. And you must understand what is the meaning of research, also very, very important. Meaning of research, you have to find out some solution for the problem. That is the thing we are doing for the research. Either it's a mini project or it may be a major project. You have to come to the conclusion that has to be utilized to the society. That is very, very important. That Manimegala is doing research for mosquitoes. I say this is a need-based research. That many of our teachers are doing research only for arriving the solution for the society. That is the way we have to go. Because I am doing the research for preparing organic fertilizer and pesticide to avoid the inorganic agricultural practices. There are small things. Little steps make a big difference. A little push in correct direction make a big difference. We are doing a simple research only, but there has to be the end result is a multi-purpose. So that's where you have to go. And the qualities of the research, how we can do the research. Quality of research means the good research, systematic, logical, empirical, and replicable. That is, systematically you can do the research. Not because of somebody forcing you to go for research. No, nothing. You have to involve yourself. You have to enhance yourself. You have to frame your objectives. You have to frame your methodology with the guidance of your supervisor. That is very, very important, that you have to concentrate. And process is, you must aware of the research process, formulating the research problem. You have to collect the review of literature. You have to frame the methodology. You have to execute the project. You have to write the results and discussion. You can go for plagiarism check and you have to submit the thesis. This is the process we are following. But all the process, your involvement is essential. Nowadays, that the students are admitting in PhD, but they are in a lazy manner. The end of the stage, the research, the supervisor only forcing the scholar, please do that one, you can complete all. Not necessary, because you are involving that project. You are doing that project. You are the owner of the project. You are the best one in the project. Why you are expecting others to force you to go for the project? Not necessary. You have to involve. You have to work. You have to get the guide from the supervisor. And then in each and every step, you must aware of your project, aware of your thesis. That's the way you have to go for that one. And my dear scholars, Not only that, you have to have a hypothesis in your project, in your thesis, because you are doing something in assumption, prediction. Something is going to happen after supplementing this something. That has to be very, very careful. And you have to, some of the points I wanted to emphasize, that there are various types of research. We can have the historical research, descriptive, ex post, various research. But you must aware of what type of research, whether it's action research or applied research or expective research or only data-based research. But these basic things you have to concentrate. Well, while entering into the PhD program, as a faculty or the scholar, you must aware of basic objectives of the research and a checklist for review of literature. Because of the project work, you are selecting the review of literature for your research. What are things you want to analyze? That is the basic concept. Is the information is reliable? Is the information is error free? Is the information is factual? Information is verifiable? Is non-biased? That all the things you have to check. Based on your review of literature only, you can go for framing the methodology. What are the already existing research? What you are going to do further research? That is the thing. Review of literature, as soon as enter into the PhD scholar and the faculty while doing the PhD program, first you want to analyze what are the review of literature available relating to a study. What are the further things you wanted to go for? That is the major thing you can concentrate. And hypothesis you have to concentrate. And you have to concentrate that you have to concentrate preparing the research design, because nowadays the students are coming how to write the research design, how to frame the methodology, how to, and that is no question of asking like this. Research design, what you are going to proceed, in what methodology you are going to apply, where you are going to collect the data, what type of data you required, what type of tools you are going to use, and how we are going to analyze, how we are going to achieve, what is the feedback you are expecting. That is the thing you must be very, very, very aware of it. That is very, very, very essential. These are the things you have to follow. And data collection also. Some of the people are doing that, collecting 10 members and multiply into 100 members. That is also to be avoided. Collecting data is essential, because your data, your results depends on your collecting the data. So you must be very, very careful. So these are the things I wanted to emphasize. The University Grants Commission has sanctioned this project only for the purpose of developing the attitude of faculty members and students for going for research work. That is the major aim of sanctioning this project. That's why we are collecting all the research scholars and our faculty members all over India, even abroad also. They are participating and they can clarify all the aspects, not only that preparing the research design and the article preparation, plagiarism check, how to write that article, everything they are going to cover. For this program, totally I think 300 members registered under this right component one, 150 members are participated yesterday. We have booked for 24 experts from all over India. They are going to share their expertise with you all for how to write the proposal, how to publish the article, what is the meaning of research, how you can go ahead with the research attitude in your field. Not only that, understanding the meaning of research methodology and how you can apply these all the things in your field also very, very essential. That's why we are conducting this research straight component one research program. Please make use of this available resources. You can develop your attitude. You can prepare well, and you can, after the program, you are in a position to send the proposal to various agencies, or you are in a position to publish the article. You are in a position to apply for a great attitude, for changing the attitude for the importance of research in your area. With these few words, I think the time 10:15 that expert is waiting, I think so. And after concluding after that, say 6 days, I will once again I come back to that forum. I can make sure that you may get better expertise about all the topics, and that time we can share what you learned from this program. Thank you very much for the opportunity given to me, that organizers and that Dean Bioscience and Bioinformatics. Thank you very much. Thank you.
Thank you, ma'am. Thank you very much for your nice. Oh, Dean ma'am, சொல்லுங்க, நீங்களே சொல்லிடுங்க. விஜய் ma'am. Vijay ma'am.
Ma'am, meet link line, ma'am.
Not necessary to go for vote of thanks are not necessary. And this is my I am expecting you people while concluding that program. We are expecting the research scholar and the research teachers, research faculty members have the positive attitude of the meaning of research and how to apply the research. That is the thing. That is
Thank
my
you, ma'am.
expectation.
Thank you very much, ma'am. Nice words. Uma? Uma Devi?
Yes, yes. Yes, ma'am. Speaker will come within a minute, ma'am. Wait, ma'am. We will wait.
The participants, I think so. கொஞ்சம் நல்லாவே யூஸ் பண்ணிக்கோங்க நம்மளோட ஆப்பர்ச்சுனிட்டியை. உங்களோட டவுட்ஸ் எல்லாம் கிளியர் பண்ணிக்கோங்க. ஏன்னா நம்மளோட இதுல வந்து மேஜர் ஆஸ்பெக்டே வந்து என்னன்னா அந்த ஆர்டிகிள் பப்ளிகேஷன் தான். அதை வந்து ரொம்ப கிளியர் கட் பிக்சர் கொண்டு போயிடுங்க. ஹவு டு பப்ளிஷ் த ஆர்டிகிள்ங்கிறத வந்து ரொம்ப நல்லா எம்பசைஸ் பண்ணுங்க. Even you can go for sending proposal, how to write the proposal also you can emphasize. What are the need based area also you can emphasize. How to frame the objectives, all the things. I think in your program you have included all the aspects. You can end of the session, you may ask the participants to prepare the project proposal also. In a group wise, ask the people also to present the proposal also is very important. And also during that period, ask the participant to prepare article also. And you have to emphasize how to prepare the article, how to check the plagiarism, how to apply. That also you can emphasize. That is also important. Participants முடிக்கிற ஸ்டேஜ்ல அவங்க வந்து அந்த ப்ரொபோசல் போடுற அளவுக்கு ரெடியா இருக்கிறாங்களா, ப்ரொபோசல் ஆர்டிக்கல் எழுதுற அளவுக்கு ரெடியா இருக்கிறாங்களாங்கிறத நீங்க வந்து ஐடென்டிஃபை பண்ணிக்கலாம். How many members are ready to send the proposal to various agencies also you have to identify. If possibilities are there, you can identify, or you can make them to aware of all the things, what are the agencies available, because that all the participants are, I think that Dean HOD Zoology have applied many projects and sanctioned many projects. They are running the projects in a successful manner. You can share your expertise with other members also, how to apply that need-based project from various agencies. That is also is very, very important thing. You can concentrate. The main purpose of the stride component one is to develop the attitude of the faculty members.
Ma'am, yesterday Geeta from library, she explained about the Turnitin and Urkun for the plagiarism software, ma'am. She explained nicely, ma'am.
Because many students are publishing the article while coming for pre-synaptic presentation, and then journal the article has removed from that particular thing. So that is the risk factor for the students are facing nowadays. So how to publish the article also you can concentrate. அது ரொம்ப ரொம்ப முக்கியமா இருக்கு. ஏன்னாட்டா பப்ளிஷ் பண்ணிட்டு வர்ற ஸ்டேஜ்ல வந்து அதை ரிமூவ் பண்ணிடுறாங்க. யூஜிசி ஆல்சோ I'm not blaming UGC, but the thing is going on. The students are suffering a lot. Research scholars are suffering a lot while coming for pre-synaptic presentation stage only. They are aware of that article is not under that one UGC careless. Please be careful for all the things. That also emphasized here. And the last point is, and that the research program after completing, how they can apply this attitude, this research ethics in their own field. That is also you can concentrate. Ethics is a major aspect you have to concentrate. Thank you. Thank you. Thank you.
Pani ma'am, shall we start, ma'am?
Yes, yes,
Yes, ma'am. Yes,
Yes.
ma'am. Uma Devi,
Yes,
you can
ma'am.
start. You
Yes,
can
ma'am.
start.
Yes, ma'am. Yes, ma'am. Okay, okay.
Thank you very much.
Thank you, ma'am. Thank you, ma'am.
Thank you. Thank you, ma'am. Thank you so much.
A pleasant morning to one and all. I welcome you all
to the second day of UGC Stride 6 days online training program on environmental sustainability and research ethics. To invoke the heavenly blessings, I call upon first year PA students.
There shall be showers of blessing. This is the promise of love. There shall be seasons refreshing, sent from the Savior above. Showers of blessing, showers of blessings we need. Mercy drops round us are falling, but for the showers we plead. But for the showers we plead.
Thank you, girls. Amidst us, we are having a vibrant personality, Dr. Nitin.
Hello. Hello. Hello, can you hear me?
Yes, sir. Yes, sir. We are able to hear.
Yes.
Sir has completed MBBS at PSG Institute of Medical Science and Research, Coimbatore, Diploma in Ophthalmology of Regional Institute, Madras Medical College, Chennai, and Sir has completed MS Ophthalmology at Christian Medical College, Vellore. Sir also has fellowship in vitreoretinal and ocular inflammation at Kochi and Singapore, respectively. Sir has completed ICO in Basic Science Examination and Optics and Refraction, International Council of Ophthalmology, Cambridge, UK. He has also completed ICO Clinical Science at Cambridge, UK, ICO and Advanced Sciences at International Council of Ophthalmology, Cambridge, UK, and FRS Glasgow Part 2 Ophthalmology. Sir has climbed the ladder from intern to the Ocular Inflammation and Immunology Fellow at Singapore National Eye Centers in the year 2018 to 2019. Sir has acquired various prizes and awards. He has stood first in ophthalmology examination in MBBS in the year 2007, runner-up in ophthalmology quiz at Clinical Refresher for Postgraduate 2011, held at Eye Foundation, Coimbatore. Sir has also backed Best Scientific Paper in Retina and TNOI State Conference correlating clinical staging with spectral domain OCT features in MA10. Sir has also published and presented in various national and international journals. I request Sir to throw light on eye for all adult groups and also he'll be focusing on diabetic retinopathy. Over to you, sir.
Thank you for the wonderful introduction. I'll just tell about myself. I'm Dr. Nitin Keshav Srinivasan. I'm in Coimbatore, Araspuram. I have practiced at the hospital called Madurai Eye Center in Araspuram. So whatever there's been in the introduction has been very accurate. Today, the topic that I'm going to talk about is predominantly on anatomy of the eye. And after that, I'll just stress upon my area of interest, which is diabetic retinopathy. So I'm a retinal surgeon and a uveitis specialist. I think I can share my screen just a moment. Can you see my screen?
No, sir.
No.
Just a second, I think I'm just finding it.
Good morning. Good morning.
So kindly unmute yourself. So we cannot hear anything. Kindly unmute yourself.
Yeah, I'm unable to share my screen. There is something called it's giving a technical.
Sir, can you send your PPT to our mail, sir? We will present them.
Yeah, that should be just.
Yes, yes, sir.
I sent the mail. Can you open the mail? I've sent the mail now.
So which mail you have sent, sir?
I think it is Ramya underscore
Okay, sir.
HV assistant. Yeah. Can I start now?
Yes, sir. Yes, sir. Yes, sir.
So I'm Dr. Nitin. The topic for today is anatomy of the eye, as well as I will be stressing upon diabetic retinopathy, the do's and don'ts. I'm a retinal surgeon and a UVIT specialist. I'm working at Madurai Eye Center in Araspuram, Coimbatore. Next slide, please. Next slide. Okay, the eye is a camera, so it is like an analogy for an eyeball, or an ophthalmic analogy for an eye is we compare it to the camera. The camera we mean is the old what you call the film camera. So where the eyelids act like a shutter, whereas the cornea and the lens acts as a focusing system, and the iris, what we call is the pupil. I'll show the next picture with the descriptive anatomical diagrams. Whereas the iris acts like a diaphragm, and the choroid acts as the dark interior of the eye, and the retina is the film. Next slide, please. Okay, so this is the anatomical structure. There are two diagrams. One is to show the cut section of the eyeball. So the outer coat of the eyeball, you can see on the right side image, is called the sclera. The white part of the eye which we see is the sclera. The next from outside to inside is the orange part, or the red part, which we call the choroid. And the next thing which is inside the eye is the innermost coating is called the retina. And whereas in the front part of the eye, if you can see, there is a structure called the transparent structure, which is called the cornea. In Tamil, we call it the curvili, or the black part which we see. Inside it is called the iris or the diaphragm. This iris is a structure which can constrict and dilate. It can constrict and dilate. And the next part is called the lens, or the lenticule. So this is the lens, is the one with aging, it is a transparent structure at younger age group, whereas as you get old, there are protein deposits happening, and it becomes cloudier and cloudier, and it leads to something called as a cataract. So the next part is called the vitreous, which is the central part of the eyeball is filled with a jelly-like substance, which is called the vitreous humor. So this is it's a basic anatomical structure of the eyeball. The next slide, please. So the components of the eye's optical system can be broadly divided into the cornea and the lens part, which is the anterior part. What is the structures which I showed you, which is in the anterior part of the eye, and which is the focusing system of the eye, which is the cornea, aqueous humor, lens, and the vitreous humor. These are the transparent structures which I showed you. So these structures act like a focus in a camera, focusing system in a camera, and these structures, with the help of some muscles attached to them, aid in contraction and relaxation, which helps in focusing the image like how we focus in the camera. Next part, please. So the first part is called the cornea, which is a transparent structure. It is a transparent and it's in a meniscus form. The diagram it shows on the right side is a cross section. So where it is in a meniscus form, and the light reflected is markedly at the anterior surface of the cornea. Okay, the next slide, please. The next structure which we see is the anterior chamber. The anterior chamber is around 1 to 2 millimeters in diameter, depth in the AC, and it can also result in, I don't want to mention that get in depth but in detail with the focusing part, but I think anterior chamber is what we call as the second part next to the cornea. Next slide, please. Next is the pupil. A pupil, or in Tamil we call as a papa, and which is the opening, which is the aperture. So the aperture in the camera you call as the pupil. So there is a blur spot on the retina shrinks as the pupil constricts. The pupil contracts and relaxes as allowing the amount of light which is getting into the eye. And with the decrease in the pupil size, the depth of focus increases. As the aperture shrinks or becomes smaller and smaller, that focus depth increases. As the pupil dilates, the focus decreases, whereas you get a wider view of the image. And after a point, the blur caused diffraction exceeds the geometric blur of the pinhole pupil. I think that is a bit more of physics. I think we'll skip that last part. But basically, the pupil is the aperture of the camera. It's the aperture of the eye, which allows the amount of light which gets into the eyeball. And based on that, for example, in the daytime, when there is a bright light, the pupil constricts and you can see a very depth image. Whereas at night time or in the evening, when there is dim light, the pupil dilates, allowing more light to get into so that your vision is not impaired. The next slide, please. So the next structure we come is called the lens, and right in the right side you can see there are multiple layers of fibers which are there in the lens particle, and this lens has muscles attached to on either side, and on contraction and relaxation of the muscles, the radius of curvature of the lens changes, which helps in focusing the eye, focusing the image onto the retina. Next, please. Okay, the retina is radius of curvature is around 12 millimeters, and the curved retina is able to cover a wider field. As you see, the eyeball is a round structure, it's like a ball, and a curved retina helps you to get the wider field. And there are something called photoreceptors, which are the cells, nerve cells, which in the retina, and these are like a pixel in a camera. Like every photoreceptor acts like a pixel, and when the light rays touch the photoreceptors, they are processed, and that gives you through the optic nerve, the signals go and reach the occipital cortex in the brain, and which gives you the image. So the multiple pixels put together gives you the final output. And the orientation of the cones, the photoreceptors there are two types. One is a rod and one is a cone. The rod is one used for bright and dim light, whereas the cone is used for color vision. So the orientation of the cones function is in a fiber optic cable, and that prevents light scattering to adjacent cones. So it is actually like a fiber optic cable. And the macula is the blue filter that limits the chromatic aberration. So these are the basically things which we try to match it with the analogy of a camera. The next slide, please. Okay, so now in brief, I have told you what is the structure of the eyeball. So the eye diseases per se, in the most common diseases which we have in our country or in our vicinity, in more so in Tamil Nadu region and South India, can be majorly cataract. That is one of the most common cause of preventable cause of blindness. And the second, I think cataract, everybody knows about it. The next thing is called diabetes is rampant in India, and Chennai is called the diabetic capital of Asia. So in Tamil Nadu as well as in Kerala, where I have worked, there is an extreme amount of diabetic population. In every house will have a diabetic in the house. The third most common thing which is eye problem which you can see is called as a glaucoma. So the glaucoma is like called like a what you call it is like a glaucoma means it leads to tunnel vision, whereas the peripheral visual field shrinks and the patient is able to see like through a tunnel vision, like through a small opening. So that is called glaucoma. So cataract, diabetic retinopathy, glaucoma are the three most common diabetic the eye illnesses which can lead to blindness. There are multiple others, but the majority or the most common prevalence of the disease which I see, if in a day, if I see 100 patients, I think apart from refractive error is the glass power or the vision correction. Apart from that, you see around 20% of the patients will be having diabetic retinopathy, as well as at 15 to 20% will be having glaucoma, and another 20% will be having cataract. Only the remaining 30 to 40% will be having other eye diseases. So the prevalence of these three are quite high. And as you know, cataract can cause what you call is like a cataract is a preventable blindness. Preventable in the meaning that you can reverse it. Once you get a high hard cataract, once you can do a surgical removal of the cataract, put in a lens inside the eye, then the patient will get back good vision. Good 100% vision is obtained. Whereas in case of diabetic retinopathy as well as in glaucoma, these are non-preventable causes of blindness. They cannot be reversible. So we need to catch them early, treat them at the earliest, prevent it from progressing. I cannot reverse whatever is lost, but by surgery or whatever methodology we do, treatment modalities, we cannot reverse the damage that has occurred, but we can prevent damage from further progressing. So these two things, the diabetic retinopathy as well as glaucoma, have to be given extreme importance, and people have to be educated, and knowledge has to be transferred, and awareness has to be created so that they seek treatment early, and that in turn prevents them from losing their eyesight. Before getting into diabetic retinopathy, if there are any questions in the, I can answer them. You can put it in the chat box. Okay, if there are no questions, then I shall move. So diabetes is a growing worldwide epidemic which affects the working age population. There is expected to be a 51% global increase of the number of diabetic patients by 2045. And Southeast Asia is going to be high, and 73 million of affected by diabetes in India as of today, as of 2000. I think this is of 2019, not today. The data is of 2019. So that 73 million affected by diabetes in India as of 2019, and this is expected to double to 134 million, which is approximately around 13 to 14 crore population to be expected by 2045. Right now itself, there are some 7 to 8 million, 8 crore people who are affected by diabetes in India. That is a significantly very high number. And this data is taken from the International Diabetes Federation, which releases every 5 years once the data regarding the diabetic population. Next slide, please. So how big is the problem? The visual disability caused by diabetes mellitus is a significant public health problem and is largely preventable and treatable. It is preventable and treatable, but it is not reversible. I am again stressing the point. It is preventable and treatable. So the prevalence of diabetic retinopathy, DR meaning diabetic retinopathy, among the people with diabetes is PWDM there, is around 16.9%, roughly around 17%. So prevalence of diabetic retinopathy among diabetic population, that is if there are 100 diabetic people, 17 people are expected to have diabetic retinopathy. And this data is from the Chennai diabetic study. This is data taken from Chennai. So Chennai means like we will in Coimbatore also we are expected to have the same amount of prevalence of diabetes. So that is how serious the problem. 17 people who are out of 100 who are having diabetes are expected to have an eye problem. The next slide, please. So DME means diabetic macular edema. So I think I will tell you briefly what is diabetic macular edema. But the eyeball, which I showed you in the anatomy, the central part of the retina is called the macula. The centralmost part of the retina is called the macula, whereas the peripheral part is the non-macular region. So why is macula important? Because the 90% of vision is concentrated in the central part of the eye. Whereas the peripheral part of the eye, there are retina, it is also retina, there are photoreceptors, but they are not actually that important for vision. They have vision, but that is contributes to the peripheral vision. Like if I'm seeing through with my eyes, I think I can see the central part is through the macula, whereas what I see without moving the eyeball, like on the side, like the peripheral door, I can see the curtains, I can see here, that is through the other part of the macula. But majority of us use our central vision to do our lifestyle, do all our work. If I want to see the peripheral vision on the retina, on the left side or at the door or something, I turn my head and check at the vision. So I turn to the right side if I want to see something on the right side. I am not using the peripheral vision. Why is the peripheral vision there? Because by evolution, when we were hunter-gatherers some 1,000, 3,000 or million years back, we needed the peripheral vision because if it's a tiger is coming to attack you, you need to have that because you don't have the split-second time to move your head and then run. So if you find any danger which is coming from the periphery, that you need to run. So for the flight and fright reflex, we had that peripheral vision. But in course of time, in this modern world, that peripheral vision is not of much use. The reason why I'm stressing it is of not of much use because I'll come to that later. So the macular edema is called anything that is affecting the macula is very important or of important concern to us. So whenever there's something that is affecting the center part, macula is called the center part of the retina. Anything affecting the center part of the retina, we need to treat early because that will immediately cause a drop in vision. So what is a DME disease burden? DME is like the diabetic macular edema. What is a disease burden? Usually diabetic macular edema occurs in working age population and the average age of diagnosis is 50 years. So around 50 years, you tend to have this, people with diabetic retinopathy tend to have diabetic macular edema. And 7% of people who have diabetic retinopathy, like around of people who have diabetes, tend to have diabetic macular edema. Like I said in the previous slide, 17% of the people who have diabetes have diabetic retinopathy, and 7% of people who have diabetes have diabetic macular edema. This macular edema is something of very grave importance, and that has to be treated early. Next slide, please. Next slide. Yeah. So VEGF, previous slide. So the VEGF is called VEGF. It's an abbreviation for vascular endothelial growth factor. It is a growth factor. It is a hormone, or it is a chemical. This chemical plays an important role in the pathology of diabetic macular edema in diabetes. So what does it VEGF do? This VEGF is something called. This may be a bit overboard for the details, but I think I feel this is highly relevant, so that to understand what is diabetic retinopathy. And my belief is like if I'm able to tell 10 people today and understand what is, make them hear the word of diabetic macular edema or diabetic retinopathy, and if they are able to tell 10 people, then at least 100 people I'm able to transfer the knowledge or able to create awareness of diabetic retinopathy. So that is why I tend to put a lot of technical terms into the slides. So VEGF is something which plays an important role. What is VEGF? It's a vascular endothelial growth factor. Vascular means vessel. Endothelium means the inner coat of the blood vessel is called endothelium. So vascular endothelial growth factor. It helps in growth of the vascular endothelium. So basically it helps in growth of the innermost part or inner coating of the blood vessel. The blood vessel and across the body has three layers. One is the endothelial inner layer, then there is the tunica intima and the tunica media. These are outer layers which helps in providing structural strength, whereas the inner layer is contains called the endothelial layer, is like of the thinnest layer and it is fragile. So this VEGF helps to start the growing the new vessels or the neovascularization. Neovascularization is something called new vessels. This helps in forming new blood vessels. Why is the new blood vessel required? That is because in case of, you can see there are something called microvascular changes happen in diabetic retinopathy. In diabetes, there will be the small vessels. Microvascular means small vessels. My diabetes affects predominantly small vessels in the body. It doesn't affect the medium-sized vessels or the large-sized vessels. So where are the small vessels in the body? One is in the eye, in the retina, whereas one is in the brain, it can cause neuropathy. One is in the kidney, it can cause nephropathy. One is in the foot, that cause neuropathy. So neuropathy, nephropathy, retinopathy, these are all because of diabetic. We call it diabetic neuropathy, nephropathy, and retinopathy, and these are all very common complications which happen due to diabetes. And wherever there are small vessels, it affects. The large vessels, it predominant doesn't affect. How does it affect the small vessels? Is like it causes production of this VEGF. And you can see in this flow chart, there is a microvascular changes and it can lead to some blockage, like there will be a blockage of the small vessels, and because of blockage, through the blood vessels only the oxygen is carried to the retinal structures. So the oxygen becomes just oxygen supply is reduced. So that is called hypoxia. So hypoxia means there is less oxygen, and that less oxygen will stimulate or increase the production of the VEGF, that growth hormone. So that hormone in a normal amount, it is okay. Whereas if it is produced in excess, it leads to something called new vessels. Like I said, it helps in growth of endothelial cells. Basically, it helps in growth of new blood vessels. And these new blood vessels are harmful. How are they harmful? Like I said, the new blood vessels have only one layer. They don't have the supporting the rest two layers, which helps in strengthening the blood vessel. So this fragile inner layer, the endothelial layer, can anytime break. It anytime burst. So when it bursts, it will lead to one, bleeding. It can cause bleeding inside the eye. You can see these red spots. You can cause bleeding inside the eye. The second thing is, like, these new vessels are also leaking because it can, so small pores are there. They don't have the surrounding covering, so they leak the water. So the blood cells stay within it, whereas the water component of the blood comes out of the new vessel, and that can result in what we call macular edema. That is basically, edema means swelling. So through the small blood vessels, the water component comes out and it can cause swelling of the retina. That is called macular edema. And second is, it can also burst, then it can cause bleeding. So these are the two things which can cause due to VEGF. And what diabetic retinopathy, what we can do, like ophthalmologists or eye doctors, is to control or reduce the production of VEGF so that it does not cause any harm. Because the blood vessels it is trying to produce is trying to produce or are more causing more harm than actual good. So that is why we tend to give injections or lasers and everything to reduce the amount of VEGF that is produced. Next slide, please. Yeah. So DME, diabetic macular edema, risk factors for development. What are the risk factors which can cause macular edema? One is a high systolic blood pressure, that is a BP. Systolic blood pressure is a high BP. Second is HbA1c. HbA1c is like for 3 months average of blood sugar which we take. And increased serum cholesterol and risk of heart accident. Basically cholesterol. So cholesterol, sugar, BP. These are three important things. High BP, everything in excess can cause diabetic macular edema or diabetic retinopathy. We'll keep it for the discussion. We'll keep it diabetic retinopathy. We don't want to get into the macular edema. The slides were prepared early, so I didn't change it. So the second thing is the duration of diabetes. The duration of diabetes means if there's a diabetic patient who's having diabetes for around 2 years, then the risk of getting retinopathy is like only 1%. Whereas if the patient is having 10 years of diabetes, the risk of retinopathy is on 20-30%. So the more amount of years you are a diabetic, the more chance you are to get retinopathy. So that is the duration. Next slide, please. So patients with diabetes are at increased risk of several comorbidities. So that is like I mentioned earlier, one is retinopathy, one is neuropathy where you can have stroke, you can see in the diagram. One is cardiopathy, like you can have a blood vessel which is going to the heart blocked. then is nephropathy, kidney, and there's neuropathy also affects the foot. That is why it's called diabetic foot, and it can cause cholesterol rise. So these are the most common complications which can cause due to diabetes. Next slide, please. So what are the clinical features? I think you can see the flow chart on the right side. So the left side image is something called an OCT. I'll show you more better pictures in the coming slides. Whereas in the right side, you can see retinal neovascularization in PDRS. So the other word, mnemonic or abbreviation you need to know is one is DME, diabetic macular edema. The second is called proliferative diabetic retinopathy. Like I said, one diabetic macular edema is because of swelling. Swelling means that there is water coming out of the blood vessel, whereas proliferative diabetic retinopathy is something where the blood vessel bursts and it can lead to bleeding. And so neovascularization, which can lead to leakage of fluid from the blood vessels, which will lead to macular edema. Once macular edema happens, it will result in blurring of vision. The vision will appear blurry and it can lead to blindness. Next slide, please. So the clinical manifestation is okay. Like you can see in the left side is the normal fundus image, and whereas on the right side, to my left, and on the right side is called a diabetic macular edema. And here the image what you see is a normal image, whereas when the patients who are having diabetes will have this blurry image. So it's called a blurry image. The next slide, please. So how do I diagnose? So okay, the patient comes to the ophthalmologist. So the most important part I would like to stress here is how do you diagnose diabetic retinopathy? So the diabetic retinopathy, like most of the people go to an optical shop close by and they get that eye part tested and get the spectacles and start wearing. Instead of skipping the ophthalmologist, it is well and good for normal patients. It should not be a problem. But the best thing is to get an eye doctor checked, because eye doctor can check the retina, whereas the optical shop which checks only the power and he gives the power correction. If you had visited an eye hospital contains for the moment you enter the eye hospital, you will be registered and taken to an optometrist. Optometrist is the optician. Optometrist is a separate subspecialty, like BSc nursing, there's a bachelor of optometry. So these optometrists are trained in a 4-year course to diagnose diseases of the eye, but they're not trained like an ophthalmologist to see the disease of the eye. They're trained to correct the vision. They can give you the best spectacles. They're trained very well to give you the basic glasses. Whereas to diagnose eye, it is the doctor who can diagnose and treat. So that fundamental difference between an optician as well as an optometrist and an eye doctor has to be understood. Why I'm stressing is like a lot of people go and get checked with an optical shop every year and change the glasses, and by the time they come to me after 5 years or so, like I mentioned, the duration of diabetes is important. They would have been a diabetic and they would not have seen an eye. They would not have seen an eye doctor for a pretty long period of time. And then when they come to me, like they will be in the advanced stage of the disease. So how do I diagnose in an eye hospital? Like we do a dilated fundus examination. So that means this is the fundus. Fundus means it's the retina. So the retinal examination. So use the fundus camera. The fundus camera will take a photograph, and that photograph will look like what the image on the left side, and the right side is the fundus camera. That image will have some bleeding blood vessels you can see, and yellow thing is called the cholesterol crystals will be there, and some leakage will be there. Next slide, please. So then we do something called OCT, or ocular coherence tomography. It is like a CT scan. Like what you saw in the left side, the retina, we will take a cut section or a cross section through the machine. This is the machine which is on the right side. That machine will take a cross section and you will see the swelling. If there is swelling, this part on the left side, the peripheral part is the. Whereas in here, you can see the small black ring areas or some black areas where there is fluid collected. So this is an OCT image of a patient with diabetic macular edema. Next slide, please. Next slide. Yeah. So this is another picture. You don't need to read through this, but the image you can see, like when the machine also gives you an output. The red thing, normally the retina should be this green and yellow color, whereas the color-coded image here you can see the red and white means there is swelling. So in the left side image, the swelling is involving the center. In the right side image, the swelling is slightly off the center. The center is the central small ring I'm saying. So this is called the OCT image of the retina. Next slide, please. So the second investigation which I will be doing in an ophthalmology is called a fluorescein angiography. So fluorescein angiography, this is like a heart angiography. Like if you have a heart attack, they will go to the cardiologist will do an angiography and check how many blocks are there. So if there's a block, they'll put a stent. It's a similar thing. It's the same dye in a smaller proportion. We check the retinal blood vessels. We inject the dye. The white thing is the dye. The dye passes through the blood vessels, and normally you can see the bottom part of the image. The angiogram should look like this. Whereas in patients with diabetic retinopathy, where you can see in the upper part there are some areas of white spots with some leakage, with fuzzy areas around it. That means the dye is gone through that small blood vessel, and it is leaking. So like I said, there is a leakage in the small blood vessel. This is small blood vessels can leak in diabetic retinopathy, and this is an example of such leakage. Next slide, please. Then this is called a B scan. It is an ultrasound of the scan, and where you can see here, you can see this is the cross section where you can see blood. Like I said, in case of vitreous hemorrhage, it's called vitreous hemorrhage, whereas this is the blood, I think. The next slide, please. This is beyond. So what we call it is called multimodal imaging. There's multiple modalities of imaging. So apart from the eye doctor side, like I can see only the fundus photo I can see, but we need to take a photo to document like how is the retina today, then 6 months later how will it be, so that when you come back to me 1 or 2 years later, then if you come with a problem after 2 years, then I will take the previous photo and see, oh, how was it yesterday or 1 year back, and how is it now. So for that documentation we take a photo. Second is like if there is a vision drop, if there is a vision is coming, that is your what you see, there is a drop in your vision, we do this OCT or the CT scan of the eye. And the third is the angiography. The angiography is done to check for leakage, and then is the B scan, is the ultrasound scan. So we don't do everything for everybody, but there are people, we will do a few of these with the various permutations and combination based on the disease severity. We do this, and based on this we will take the call on treatment. So the next slide, please. So what is the treatment for diabetic retinopathy? It's a multimodal imaging. This is a multifactorial approach. So what is multifactorial approach? The basic thing, what you need to do for the most basic treatment thing is control blood glucose or control sugar. Second, control pressure. Third is control cholesterol. Control sugar, pressure, cholesterol. This is basic. This is the palapadam. This is the basic thing you need to do. And after that, the next thing is the eye treatment. The eye treatment, what we need to do is like various things. One is an injection, like you don't need to, and one is a laser, and third is a surgery. So we do an injection into the eye to reduce the swelling. If laser is into to convert the hypoxic retina anoxic, basically to prevent the new vessel formation. The injection and the lasers which we give is all things are directed towards to prevent new blood vessel. Like I said, new vessel formation. The new blood vessel formation we try to avoid. For that we do all treatments. If it crosses beyond a section, beyond my capacity, beyond medical treatment, like beyond injection, beyond laser, then we need to do surgery and correct it. Next slide, please. So the treatment, like I said, sugar control. So okay, then a broad thing, what is needed is like to control sugars, control pressure, control cholesterol. The next is regular eye examination. That is the most important thing. Before all this laser, before injection, before surgery, whatever things I am going to do, you need to come for a regular eye examination. How regular is the minimum of once a year. Minimum an annual checkup when you don't have diabetic retinopathy. The people who are diabetic, like I said, 17 people out of 100 diabetics will have retinopathy. So what it means is the 100 people with diabetics has to check an eye doctor at least once a year. Checking with the diabetologist is not enough, and you need to get it checked with an eye doctor. So at least you need to check with an eye doctor once a year minimum. So once you check with once a year for minimum, and the next you need to check is like once a year minimum, and then if they have diabetic retinopathy, that these are people who do not have retinopathy, where the eye is perfectly normal, even then they have to check once a year. People who have retinopathy, there are various grading like mild diabetic retinopathy, moderate diabetic retinopathy, severe. So I didn't go into the classification now because that is beyond the scope of the discussion. So if you have some diabetic retinopathy, if the retina is affected, then your frequency of eye checking changes from 1 year to 6 months or 3 months. That is based upon the eye doctor's discretion, based on your severity. If you are very severe, you need to come every month. If you are less severe, you may need to come 6 months once, then monitor. So what is important is regular eye examination. I have mentioned to put a word there, regular dilated eye examination. Dilated is the right word. Dilated means putting a drop, dilate the pupil, like I said in the first part, dilate the pupil and then check the retina. Because without dilating the pupil, like if you see through dilating means like if you go to an eye hospital, the first thing after checking vision is they'll put a drop and ask you to wait for 45 minutes. You wait for the half an hour, then the doctor will see. Because the time of half an hour to 45 minutes is for the pupils to dilate and then for the doctor to see the patient. So that is what is called a dilated fundus examination. So I missed the word there. So you need to dilate. Why dilate is even for an eye doctor. I am trained in retina for 10 years now. So even after 10 years of seeing through a small hole without undilated, without putting the drops, if you ask me to see, I will see only the center. I will not see the periphery. So there might be problem in the periphery. Like periphery means in the without things which I'm not seeing through the small hole. So that which I will miss. So even for me, after 10 years, I tend to miss. So I need, when you come to my hospital, I will ask you to dilate and only then check, because only then I will see the whole retina. Otherwise I will be seeing only 20% of the retina, 80% I will not see. So why I am stressing is, like, even if you go to an optical shop or if you go to an eye doctor and you are in a hurry, I want to see fatafat, I need to see go of half an hour. So that is not advisable. You need to dilate, you need to wait for an hour or an hour and a half and then get your retina checked if you are diabetic. All this is for diabetic people, not for normal people. So once you get your eyes checked after all the dilatation, only after dilatation you need to get the eye checked. So if you go to an optical shop or go to an eye doctor and without dilatation, if you're getting checked, ask the eye doctor, please dilate, I am a diabetic, dilate and see my fundus and let me know. So that is one important thing which you need to know. And most of the eye doctors dilate. So that is, I'm stressing it again and again, because a lot of people miss the dilatation. Even I sometimes miss the dilatation. If the patient is in a hurry, I will also skip it. So do that. Second is, once you cross the threshold, once you got diabetic retinopathy, when the retinopathy is crossed to a stage of mild to moderate, then you start getting vision drop, your vision is dropping. And one important thing I would like to say is, even if you are having a severe diabetic retinopathy, that you might still be having 6/6 vision. 6/6 means 100% vision. That means, like, the periphery, the whole of retina, the periphery will be very aggressive retinopathy can be there, whereas the central part of the retina, there is a macula. What I said, the macula might be spared. It is called macula sparing. So macula might not be affected. It will get affected maybe in a week or two, whereas the peripheral retina is already in a end stage. So even then, that means even in a very severe stage of retinopathy, you can still have 100% vision. So what it implies is, like, even if you have good vision, if you have 100% of vision, you need to go and get your eyes checked by an eye doctor. Even if you have 100%, you can say, because the periphery will be affected, whereas the center will be spared till the end. And one fine day, the center will also be affected. Then nothing, gone, zero. Then you will not have any vision. You will go to blindness on that day. So that is why I want to stress here, even if you have good vision, even if you have 100% vision, at least once a year, a diabetic patient has to get their eyes checked with an eye doctor. Okay, once you cross a threshold, like, okay, now the vision is dropped, I need to get, this is the staging of diabetic retinopathy, cross from A to B, or from stage 1 to stage 2 and 3, then you need to get your lasers done as well as injections done. So laser and injection is like, basically all these things are done, laser as well as injection, to reduce the VEGF, what I said, VEGF, the growth factor. So the injections are basically anti-VEGF, antibody to the VEGF, antibody, like an antibody which goes and blocks the growth factor and prevents it from functioning. Laser is like something which burns the retina, and laser we do on the periphery, we don't do on the macula. Laser is something which burns the retina and prevents the retina from laser is something which burns the retina and prevents the production of VEGF. So only with the retinal and then the VEGF production. So production is what you call burn it. With use laser, it's basically laser heat, and it's basically burning the retina. The retina like basically with laser you just heat it and burn it, so that the production is not there. So then laser, second is called injection, and next, if nothing works, laser injection is also not working, and finally you go to surgery. Next slide, please. Next slide. Yeah. So anti-VEGF therapies, like what is like the injection? Anti-VEGF means injection. In 80s, like there were no injections. Basically, only laser was there. In the 90s, there was something called steroids were injected into it. From 2000 onwards, like the VEGF, the injections have come. In India, I think after 2010, the last 10 to 12 years, now we are having these injections have grown up massively, and there are a lot of injections we are giving. The next slide, please. The next slide. Yeah, so the previous one. The previous slide. Can I have the previous slide? Yeah, okay. The next one, sorry. The next one, sorry. I think I missed this. The next slide. Yeah. So now coming, yeah, this one. Hold it. Yeah. So next coming to patient education and counseling. The next slide. Yeah, this is fine. So one is like basically you need to educate. That is what I'm doing now to people who are there in the webinar. So I think there are 100 people who have joined now. So like educating type 2 diabetic patients every 3 months has a statistically significant beneficial effect on the metabolic control. This is a study called Romeo study, where it's called Rethink Organization to Improve. They found is like you do a type 2. What is type 1 and type 2? Yeah, I'll tell you briefly. Type 1 is diabetic is basically who are young patients who have their pancreas, what you call that insulin producing cells which are damaged very early. So most of the type 1 patients are young diabetic. There is a very definitive thing. Somebody called young diabetes is somebody, young diabetic is of more risk. It is of very severe disease happens. Whereas type 2 diabetic are people who are having diabetes after 50 years. Young means less than 50. Old means more than 50. So if you get a diabetes after 50 years, you are classified as a type 2 diabetic. Whereas if you get diabetes in less than 50 years, you are classified as type 1. This is not exact definition. For simpler understanding purposes, I'll put it as type 1 and type 2. So type 1, as far as retinopathy, eye problem is concerned, can cause a very severe disease. Whereas type 2, the disease is generally moderate. Whereas if type 2 disease, the retinopathy takes 10 years to progress, whereas in type 1 patients, it progresses in 2 to 3 years. The type 1 diabetic patients or the disease intensity or the disease or the virium, Vyadhi or the virium is very high. So what is more virulent. So basically you need to keep them monitored very closely. 3 months once, 2 months once, young diabetic, 30 vayasula diabetic, 35 vayasula pathina vishane poyirum. So all those young diabetic patients have to be monitored, closely watched, and given treatment as ASAP, as early as possible. Type 2 diabetic, is what I said earlier. They also need to be monitored, whereas type 1 is like something you need to be very careful. Next slide, please. Next slide. Yeah. So this is a paper which we published when I was in Vellore. I did my post-graduation in CMC Vellore. So at that time we published this is my thesis paper. So this was called Diabetes and Diabetic Retinopathy, Knowledge, Attitude, Practice. We call it KAP, Knowledge, Attitude, Practice Study among diabetic patients in a tertiary eye care center. Tertiary eye care was CMC Vellore. So the next slide. So what are the objectives of the study? So we did a study in which we documented the knowledge, attitude, and practice patterns of diabetic patients regarding diabetes and diabetic retinopathy to determine the association between knowledge and practice patterns and to identify barriers to compliance to follow-up and treatment. So these are the primary objectives. Primary objectives were to understand the knowledge, attitude, practice. I think KAP study is something you can go and read about it. And so this is one of the KAP studies. Second is to determine the association between knowledge and practice. If the knowledge is good, are they doing good practice? Practice meaning like, are they coming to regular eye checkup? Are they seeing the doctor as prescribed? Are they taking the diabetic medications properly? And the matter a questionnaire. So basically the study was around 50 questionnaires, 15 questions were put, and the questionnaires were given to patients, diabetic patients who came to CMC Vellore. And then we also map the thing, we have to agree, moderately agree or moderately disagree, and we had grading, and based on that we did a knowledge study. Next slide, please. So the primary outcome we expected was proportion of patients with good knowledge, நல்ல knowledge regarding diabetes பத்தி எல்லாம் தெரிஞ்சிருக்கு. Then a positive attitude means நான் ஆப்ரேட் பண்ண நான் கரெக்டா டாக்டர் கிட்ட ட்ரீட்மெண்ட்டுக்கு வந்தா எனக்கு கண்ணு பிரச்சனை வராம இருக்கும், ஆர் டயபெட்டிஸை கண்ட்ரோல் பண்ண முடியும் இல்ல அப்படின்ட்டு. Because some people are all negative, like they will be like what you call, இந்த மாதிரி வந்து this is not correct, what you call, என்ன பண்ணாலும் என் கண்ணு போச்சே, like that. Some people had a negative attitude, like எனக்கு சுகர் வந்துருச்சு அவ்வளவுதான், என் கண்ணுக்கு ஒன்றும் பண்ண முடியாது, சுகர் வந்துட்டு அவ்வளவுதான், லைஃப் வாழ்க்கை நான் இப்படியே தான் இருக்கணும், அந்த மாதிரி like people some that negative attitude. So third is good practice pattern regarding diabetes. Good practice pattern means like coming to the doctor regularly, கரெக்டா மாத்திரை எடுத்துக்கிறது, கரெக்டா ட்ரீட்மெண்ட்டுக்கு வருது, கரெக்டா ஐ செக்அப் பண்ணிக்கிறது. ஓகே, so these were the things which were documented by issuing a questionnaire and asking them to fill the questions. Next slide please. So the study design was a hospital-based cross-section study and conducted in the OP patients of ophthalmology department in Vellore. Next slide, please. So this is because you are in a research thing, I thought I'll put my research into the PowerPoint slides. So that's why I thought I'll include it. So the workflow is like diabetic patients in the department of ophthalmology who met the inclusion criteria, and then we got informed consent to recruitment and data collection using questionnaire. Answers were scored and collated, analyzed. So dilated fundus examination is done in all patients to document the presence and level of diabetes. Basically, dilated fundus examination was done, and I mapped what's the grade of diabetic retinopathy also. Next slide, please. I think next slide. Okay, next slide. Okay, the total study population was 288 people we took, and 108 had diabetic retinopathy and 180 did not have. Basically, diabetic population 288, அதில் 108 பேருக்கு diabetes இருந்துச்சு. That was a high prevalence. That is because I think most of the people, it was coming to the hospital. So the diabetic patients யாரெல்லாம் ஹாஸ்பிட்டலுக்கு வந்தாங்களோ mostly ஏதோ பிரச்சனையோட தான் வந்திருக்காங்க. So that is why 50% or nearly 40% was there. The normal population வந்து it is only 17%, whereas it was a CMC வெள்ளூர்னால, it's a tertiary care center நால people who came had more of diabetic retinopathy. அதில் நான் சொன்ன மாதிரி moderate to mild to moderate NPDR, then severe NPDR to PDR, and the கீழே பார்த்தீங்கன்னா you can see maculopathy, that is a DME நான் சொன்ன மாதிரி, அதில் எத்தனை இருக்குன்றது. Next slide. So, okay, so what we concluded is like only 17% of the patients who have aware of retinopathy as an ocular complication. அதாவது என்னன்னா, நான் பார்த்த அந்த 288 பேர்ல வந்து 17% மட்டும்தான் ரெட்டினோபதின்னு ஒன்று இருக்கு, பிகாஸ் கண்ணு சுகர்னால கண்ணு பாதிப்பு ஏற்படலாம் அப்படியா அப்படின்ற மாதிரி தெரிஞ்சுக்கிட்ட ஆளுங்க 17 பேர் தான். ஸோ 83 people did not know கண்ணு பாதிப்பு ஏற்படும், ஒரு ரெட்டினோபதின்னு ஒன்று இருக்கு, சுகர்னால இது பிரச்சனை வரும்ன்றதே 83% did not know. And even among the 121 patients with good knowledge, and the 120 பேர் who had good knowledge, only 9.9, that is 9.9 or 10% had good knowledge of retinopathy. Diabetes பத்தி நல்லா தெரிஞ்சிருக்கு. அதோட அர்த்தம் என்னன்னா, they knew about diabetes. ஸோ சுகர்னால டயபிட்டிஸ் வருது, நம்ம இதுக்கு வாக்கிங் போகணும், நான் இதுக்கு வந்து சாப்பிடணும், நான் கரெக்டாக மாத்திரை எடுத்துக்கணும். பட் ஈவன் தென் only 10%, அந்த நல்லா டயபிட்டிஸை பத்தி தெரிஞ்ச அளவிற்கு retinopathy பத்தி தெரியல. So only 10% of that population who had good knowledge of diabetes had a knowledge of retinopathy, while 65.29% were not even aware of retinopathy. 65% retinopathy அப்படின்னா என்ன, கண்ணு பாதிப்பு ஏற்படுமா, அப்படியா சுகர்னால கண்ணு பாதிப்பு எனக்கு தெரியாது அப்படின்றதா 65%. This study was done in 2014 or 7-8 years back. I don't think much has changed from the 7 years until since that study was done. So அதுக்கப்புறம் this indicates a poor state of patient education measures regarding retinopathy. Diabetes பத்தி நல்லா தெரிஞ்சிருக்கு, பட் retinopathy பத்தி தெரியல. Diabetes பத்தி awareness நிறைய இருக்கு நம்ம மக்களுக்கு, பட் retinopathy பத்தி தெரியல. So that is what was the conclusion of that, one of the conclusions. The next slide. Next slide please. Yeah, so then we did the odds ratio. The odds of the patients with good knowledge of diabetes having a positive attitude to diabetes is 4.2 times than those patients with poor knowledge. That means like diabetes பத்தி நல்ல knowledge இருக்கிறவங்க who know about diabetes had a positive attitude towards diabetes than those with poor knowledge. அதாவது diabetes பத்தி, retinopathy இல்ல, நல்ல diabetes பத்தி நல்லா தெரிஞ்சிருக்கு, இது நான் பண்ணணும், நான் எக்ஸசைஸ் பண்ணணும், நான் மாத்திரை சாப்பிடணும், நான் உணவு கட்டுப்பாடு இருக்கணும், இதெல்லாம் நான் if I do it, நான் வந்து சுகர்ல இருந்து நம்ம வந்து கண்ட்ரோல் பண்ணிக்கலாம். I can lead a comfortable life even with diabetesன்றது வந்து 4x more than those patients. அதை பத்தி எதுவுமே தெரியல, டயபிட்டிஸ் அப்படின்னு என்ன, சுகர் கண்ட்ரோல் பண்ணுமா, வாக்கிங் போகணுமா அப்படின்ற மாதிரி தெரியாத ஆட்களுக்கு it was better. And as the knowledge of the disease increases, the attitude towards the disease becomes positive. So enna, if you give knowledge, that is like if you are able to impart knowledge to a person, like whatever, diabetes, like any disease or anything, in life. So if you are able to, then the attitude towards the disease becomes, if you know more about a disease, then you will take the right things and treatment and methods to counter it. So it's the duty of the physician. Physician is the doctor to impart the knowledge. It's my duty to tell the patient what it is. If a patient comes to me, I have to explain to them in simple terms, this is what it is, and it is controllable, it is treatable, and this is, if you do A, B, C, D, E, then you will be able to reach the conclusion again. So knowledge about the disease and its complications. Now, disease is a powerful tool, whereas in case of countering and getting it treated. Next slide, please. So the barriers to complaints, in our study we found barrier. எதனால வரல, ஏன் வந்து அவங்க கிட்ட கண்டாக்டர் வரல அப்படின்னா 14.24 patients person did not complain with regular follow-up visits with physician. Diabetologist கிட்டே போறதில்ல, சுகர் மாத்திரை வாங்குறதே கிடையாது 14%. 61.1% did not go for periodic eye exam. 60%, 100 பேர் டயபெட்டிக், 60%, 61% did not go to eye doctor. And 63% did not know they should go. 63 பேர் போணுமா, கண்டக்டர் பார்க்கணுமா, டயபெட்டிஸ் வேற ஒன்று, சுகர் தானே, அதுக்கும் கண்ணுக்கு என்ன சம்பந்தம், அப்படி சொல்ற ஆட்கள் வந்து 63 பேர். And 48% did not go since they had good vision. And then, as I told you earlier, 48 means 50%. 50% people எனக்கு நல்லா தானே பார்வை இருக்கு, நான் அதுக்கு போகணும். Because even if you have good vision, again stressing, even if you have good vision, the diabetic retinopathy, maybe 90% of the retina will be affected. 10% வெளியே பார்த்துட்டு இருப்பீங்க. So even if you have good vision, you should go. So 48% did not go because நல்லா இருக்கு பார்வை, நான் அதுக்கு போகணும். That is the reason. Then the duty of the ophthalmologist to educate the diabetic patients in their clinic. So same thing again, நான் சொல்லிட்டே இருக்கணும், I need to keep on educating them, then you need to come. Next slide. So visual impairment and blindness due to diabetic retinopathy is almost entirely preventable with early detection and timely treatment. It is entirely preventable. It is not reversible, but it is preventable. Early treatment and early detection, timely treatment. இது ரெண்டுமே முக்கியம். And awareness and knowledge about diabetic retinopathy is poor among patients in the study. Lack of knowledge about screening of retinopathy is a major barrier. So basically, when they didn't have knowledge, ஒரு கண் செக்அப் பண்ணணும்ன்றே தெரியல, அது தெரியாதவங்ககிட்ட எப்படி வந்து பண்ணுவாங்க. So they should at least know initially. So they should be aware of it first. Awareness and education is more important. அதுக்கப்புறம் தான் they will come. அதுக்கப்புறம் தான் practice and attitude. So first is knowledge, and then is the attitude. பண்ணிக்கலாம் அப்படின்ற ஒரு பாசிட்டிவ் attitude இருக்காம செய்ய முடியும் அப்படின்ற. Third is the practice. Then இதெல்லாம் ரெண்டுமே கிளிக் ஆனாதான் மூணாவது practice. அதாவது கரெக்டா வருவாங்க, ட்ரீட்மெண்ட் எடுத்துக்குவாங்க. Next slide please. So good knowledge about diabetes significantly associate positive attitude towards diabetes and good practice. That is what I said. And awareness of retinopathy significantly associate good practice regarding it. That people who are aware of retinopathy, kannila prachana varala therinjavanga correcta vandu check pannitaanga eye doctor. So in that study, an urgent need to evolve strategies to educate patients about potentially blinding complication of the urgent need to evolve strategies. It's been like 7 years since I did this study. How to evolve strategies, I am still exploring. We are planning to launch a portal for diabetic retinopathy in which people can know and they can put up questions there. It's not yet available now. Then we will give us, like, it's a free portal. You can put in your questions and suggestions and I will reply to that. The next slide please. So what does the patient want to know? So will my vision improve? That is first question. Is there a chance for deterioration? இதெல்லாம் கேள்விகள் என்ன ஓபியில் உட்காந்து கேட்கும்போது எனக்கு வர கேள்விகள். So I thought I'll put it. பார்வை இம்ப்ரூவ் ஆகுங்களா, நல்லா கிடைச்சிருமா, இஸ் தேர் சான்ஸ், இதை விட மோசமா போகுமா, எத்தனை இன்ஜெக்ஷன், if you come to an eye doctor, if you had anybody relative, they would have definitely, with diabetic retinopathy patients, would have had 1 or 2 injections. எத்தனை இன்ஜெக்ஷன் தேவை, இன்ஜெக்ஷன் எடுக்கணுமா, எந்த இன்ஜெக்ஷன் போடலாம், there are 2-3 types also. Side effects இருக்கா, what are the side effects, if I had stroke or if it's not improving, why is it? So all these complication questions we get. So இதெல்லாம் எதுக்கு இந்த questions போட்டேன்னா, because effective counseling helps patient to maintain compliance to treatment. So if there is a good counselor, they can tell the patient this you need to do, இதெல்லாம் தான் நீங்க பண்ணணும்னா, then there will be maintain compliance to treatment. Next slide please. Keep the patient motivated. எப்படி மோட்டிவேட் பண்ணுவீங்க, எப்படி பேஷண்ட் வரவங்க மோட்டிவேட்? I need to show the images. நான் இப்போ உங்களுக்கு ஃபோட்டோஸ்லாம் காமிச்சேன்ல, the OCT image, fundus image, I show the same photos to the patient. So when you show the patient what are the problems na, then they will know இதுதான் பிரச்சனை அப்படின்னு. If I don't show them images, இப்போ நான் போடுற இமேஜ் எல்லாம் நம்ம சும்மா வாயிலே பேசிட்டு இருந்தோம்னு வச்சுக்கோங்க, இதுதான் இருக்குன்னா, then they won't be motivated to get treatment because it is a long term problem. இப்போ நீங்க வந்துட்டு கேட்ராக்ட்னா இன்னைக்கு முடிச்சு கேட்ராக்ட் பண்ணி நாளைக்கு அனுப்பிச்சிட்டேன்னா அவ்வளவுதான், I don't need to see him again. He'll get good vision, he's happy, I am happy. Whereas diabetic retinopathy is like it's a disease for lifelong. You need to keep monitoring, coming back to me over again on the park. They have to feel motivated to come back to me so that I'm doing something good for them. அதுக்கு வந்து I need to show them images. இந்த மாதிரி photos காமிச்சு இது காமிச்சு they need to remind them அதெல்லாம். And vision showing improving trends. அதாவது பார்வை இம்ப்ரூவ் ஆகுதுன்னா I need to document and show. போன மாசம் வந்தீங்க இன்ஜெக்ஷன் போட்டோம், இப்போ அதுல இருந்து இப்போ இம்ப்ரூவ்மெண்ட் ஆயிருக்கு அப்படின்றது I need to document and show them. ஓ, ஒரு லைன் இம்ப்ரூவ்மெண்ட் ஆயிருக்கு, கரெக்ட், டாக்டர் பண்ற விஷயம் வேலை செய்யுது அப்படின்னு. Reducing the follow-up frequency by phone, WhatsApp, because you can call. We have a WhatsApp channel also. It's called for the retina clinic. So they can message and they can ask me, and we will give responses through the WhatsApp. And reducing the number of injections. I think it's for ophthalmologists. Change injection. Okay. And these are all for the next 3 things are for the ophthalmologists. The next slide, please. Next slide. Yeah, I think it's done. So any questions, I can take it up if it's in the chat. I think I have 10 more minutes in any grant. So any questions?
Thank you, sir, for the insight on the care of eye. And now the session is open for discussion. I think Anshita Purohit and Dr. Varsha have raised their hands. Anshita Purohit and Dr. Varsha.
Hello, good morning, sir.
Good morning.
I am Dr. Varsha from SM Joshi College, Hadapsar, Pune, Maharashtra.
Yeah, go ahead.
My grandmother having the problem of dropping of eyelids, and doctor will be concluded as it is the myasthenia. But other second opinion is that there is not the myasthenia, but the eyelid having the higher power. Because of that, they are dropping on that, and they are having the many troubles because of the dropping of the eyelids. How we will conclude that it is a myasthenia or the other disease?
No, I think myasthenia. I think what is ocular myasthenia. So if there is myasthenia, there are a few tests which we do. We inject a drug and check if the drooping of the eyelids improve with the drug. So
when diagnosed it is in myasthenia, there is the one test related to the blood, that is the acetyl-CoA will be increased in amount in the blood.
Yes.
And there is the connection between the muscles and nerves. This connection is poor. This diagnosis will be done one doctor, and another doctor they call as the another disease, and they are having the higher amount of the power in high power in the eyelids, and because of that there is the they suggest there is no any medicines, but we are getting the one injection in the eyelids, and we are semi-paralyzed these eyelids. Is it possible or
okay, what I understood is this is called ocular myasthenia. Like you said, acetyl-CoA will be the levels will be reduced, so that is one issue. So if you diagnose and if you confirm myasthenia, there are 2-3 tests which you do. I think they would have done the test. If the ocular myasthenia is confirmed, then the treatment is to treat it by some medications. And the other thing what they suggested, I personally think, is a botulinum toxoid. So when they inject that into the eyelids, it might help them for a temporary basis. I think it's a temporary thing. The injection into the eyelid is only for 3 months or 6 months. It will be working. After that, we may need to re-inject again and again. Because without knowing about the complete history, I cannot comment. But these 2 things are possible. Either you need to treat the injections or you can take medications for lifelong.
Thank you, sir.
Thank you.
Dear delegates, any other queries? Okay, so we have come to the end of our session. Thank you, sir, for the insight on the care of eye and giving us a bird's view on diabetic retinopathy, which is one of the medical concern. Thank you for your presentation, sir. Thank you.
Yeah, thank you everyone. Thank you everyone for the patient listening. Thank you.
Ma'am?
Ma'am, can we go ahead with the second session, ma'am?
Yes. Yes, ma'am has already joined Sabha, ma'am. Can introduce her, ma'am.
Yes, ma'am. Our second speaker is Dr. Satyabama, Professor, Department of Botany, Bharatidasan University, Tiruchirappalli. And her topic for the session is nanotechnology for enhanced crop productivity. Ma'am has climbed the ladder from lecturer to the professor, and ma'am has research experience for more than 25 years and completed DBT postdoctoral fellow in the Department of Biochemistry in Indian Institute of Science, Bengaluru. And her area of research is plant and microbial technology, molecular plant pathology, and nanobiotechnology. Ma'am has also received various achievement and awards to add feather to her cap. Few INSA DFHE Visiting Assistant Award to Germany, and INSA CAS Visiting Scientist Award to China 2016. Ma'am is also a fellow in the Academy of Sciences Chennai, an outstanding reviewer in Elsevier, mentor in Life Science DST Inspired Program at New Delhi, external expert CISR Assessment Committee in the area of Bioscience and Biotechnology. Ma'am is also a member of Preliminary Assessment Committee, Shastri Indo-Canadian Institute, Government of India, New Delhi. Also reviewer at DST SERB Major Project, Translation Reviewer at National Translation Mission, Government of India. And also she is an editorial board member at Frontiers in Plant Science, Frontiers Pharmacology. Ma'am is also a member of various professional bodies, to name few: life member at National Association of Biological Science, life member Swami Botanical Club, and member at American Chemical Society. Ma'am also has teaching experience of more than 21 years. She has organized various seminars, conferences, and workshops, and also reviewer of many of the national and international journals, and member of several academic bodies. Ma'am, I request you to go on with the session.
Thank you, madam. Thank you for your nice introduction. And thank the Avinashilingam University Department of Botany for giving me this opportunity to interact with the participants of the UGC STRIDE program. And I thank the HOD of the department and other faculty members who had did this work. So I'll go my presentation.
வரமாட்டேங்குது மேம் ப்ரெசென்டிங் அவங்க ப்ரெசென்ட் ஆகுதுன்னு கேளுங்க.
Can you able to see the slides, PPTs?
No, ma'am. No, ma'am. We are not able to see.
Okay. இங்க இருந்து பண்ணுவாங்கம்மா.
அதுதான் மேம் நம்மளுக்கு தெரியுது, அவங்களுக்கு காமிக்க முடியல மேம். எஸ் மேம்.
வேற யாரும் போடுங்க.
Ma'am, or else you can share the slides alone, ma'am. We can present it.
Send slides அனுப்பி விட்டுமா?
எனக்கு மெயில் அனுப்பி விடுங்க மேம்.
மெயில் அனுப்ப சொல்றாங்க.
நம்மளுக்கு காமிக்குது, ஆனா ஷேர் ஆக மாட்டேங்குது மேம்.
காந்தி கொடுங்க. எதனால?
Ma'am, now the slide is visible, ma'am.
Visible? Okay, yeah.
Yes, ma'am.
Yeah, thank you.
Yes, ma'am.
So, the topic of my lecture is nanotechnology for enhanced crop productivity. So, we are facing challenges in food production due to several factors. That is, the major things are the population growth, climate change. Along with that, due to the climate change, the insect pests and the pathogen affect more the crops, and the yield reduction is the results of these things. And to meet all these thing to in the that is the to meet the population growth, we have to go for the enhanced production of the crop. So generally the agrochemicals are used by the farmers to enhance the production, and this conventional agrochemicals degrade the agro ecosystem, and also due to the application of these chemicals, the pathogens that is they form the resistance in it, and so whatever the chemicals what we are using, they will not meet to the production, and the also the application of the agrochemicals lead to the negative effect on the environment. So we have to go for the alternate technologies to get rid of these things. So the development of technologies that improve food productivity without adverse impact on the ecosystem is the need of the hour. So in this context, the nanotechnology has emerged as a technological advancement that is to get rid of the biotic as well as abiotic stress. So what we are working is to look for the biotic stress, and the nanomaterials, they hold a great promise, and that is in protecting the plant due to their size-dependent qualities, high surface to volume ratio, and unique optical properties. So this is the properties of the nanomaterial. So that is why it entered in all the industrial applications. And in the crop protection, nanomaterials are used. The generally used nanomaterials initially followed were the carbon-based nanomaterial, Then the metal-based nanomaterial. In the case of carbon-based nanomaterial, it is the single-walled carbon nanotubes and the multi-walled carbon nanotubes. They can penetrate easily the surface of the plant, that is plant surface seeds easily, and enhance the germination, and also it enhance the growth of the plant. So likewise, the metal-based nanoparticles like silver, copper, zinc, titanium, etc. have been used in the crop protection to enhance the protection of crops from the biotic as well as the abiotic stress. So among the nanoparticles, that is metal-based nanoparticles, the nanosilver is the most utilized, and there were more research on this metal. Because this possesses very high antimicrobial property, and also it have a positive effect on plants. So the nanomaterials are generally what, when you go with the advanced technologies, we should aim to reduce the input of fungicides, that is to increase the production. So if you use the metal-based nanomaterial, again, that is the adverse effect on biological system and the possible environmental toxicity is not yet researched, and because since it is in the infant stages, we cannot come to a conclusion of what is the effect of these metal-based nanomaterials in the environment. So that is a big question, whether we can use the metal-based nanomaterials in crop protection or not. So that's why the selection of nanomaterial is very critical, and hence we have to choose the material what we are using for the preparation of nanomaterial. That is very critical. That should be of that is they should be non-toxic, they should be biocompatible, and also biodegradable. So if these characters are used in the synthesis of nanomaterials, then naturally it will it will not have any negative effect. So with this in mind, we are working on the nanomaterials which are prepared from natural sources. That is the use of bio-based nanomaterials for crop protection is of interest. That is why we are using we are preparing the nanomaterials from the natural sources. So for that we are using the chitosan. So the chitosan is the deacylated.
Sorry to disturb, ma'am. Ma'am, slide the first slide, ma'am.
First slide.
It is still in the first slide, ma'am. Yes, ma'am.
It is in the first slide. Oh, it's not moving.
Yes, ma'am. Yes, not moving, ma'am. Yes, ma'am.
Sorry. Yeah. Just a minute. Move ஆகுதாம்மா காயத்ரி?
இல்ல மேம். Still in the first slide, ma'am.
ஃபர்ஸ்ட்லயே இருக்குங்க.
Now it has come to ketosan, ma'am. Separation of ketosan.
Oh. இப்போ ஃபர்ஸ்ட் போங்க, மூவ் ஆகுதான்னு பாத்துக்கலாம்.
Yes, ma'am. Now it's moving, ma'am.
Now okay?
Yes, ma'am. Now in challenges, in the second slide, ma'am.
Yeah, okay. So that is why
now it has changed to conventional agro.
So the conventional agro system, that is the degradation of agro ecosystem, and also the resistance were developed by the pathogens, and it leads to the negative effect on the environment. So the development of technologies that improve food productivity without adversing the impact on the ecosystem is the need of the hour, and hence we are working on the nanomaterials. So nanomaterial, in the case, that is they have properties like they have size dependent qualities, they have a high surface to volume ratio, and also unique optical properties. And generally used carbon nanomaterials in crop protection are carbon based and metal based. And the negative effect of this metal based the nanomaterials is not yet, because it is in the infant stage. That is, we do not know about the adverse effect of these nanomaterials on the environment. So we are working on the nanomaterial preparation from natural sources. So in this, we are working on chitosan. So chitosan is a deacetylated form of chitin. Chitin is the second most abundant polymer on Earth. So it is a linear polysaccharide composed of alpha-1,4 linked glucosamine and N-acetyl glucosamine. And the deacetylation of this chitin can be done either by chemical or biological method. So this slide shows the presence of chitin in the nature. That is, they are present in the exoskeletons of arthropods. They are present on the shells of mollusks, cell walls of fungi yield mold, and some other invertebrate animals also possess this chitin. And apart from that, the diatoms are also made up of chitin. So all this, so this is how it is present in the nature, and it is the second most largest polymer on the earth. So this is the preparation of chitosan from chitin. So chitin has to be deacetylated to get the chitosan. So the chitosan is produced commercially by adding, that is, the deacetylation can be done by application of sodium hydroxide to the chitin, and that will allow the deacetylation and leads to the chitosan. So the chitosan is used in the case of crop protection because they are biocompatible, they are biodegradable, non-toxic, and they have antimicrobial properties also, because they are charged, that is, the cationically charged, hence it is easily go and attach with the negatively charged cell walls of the pathogens, and hence it enhance the degrade the cell and enhance the production of the crops. So this is because it is a renewable resource, and also the application of chitosan enhance the resistance in crop plants. Apart from this, the chitosan has the receptors on the plant surface. So because of this, they can easily attach to the surface of the plant and go into the plant cell. And also it can be functionalized, that is, they have a functional group so that you can easily functionalize it. So with this background, that is the chitosan, they have most positive properties. Why we are going for chitosan nanoparticle? So this is the slide showing that properties. That is, the chitosan is insoluble in water. So the bulk chitosan in aqueous media limits its wide spectrum in agriculture because of the insolubility of it. Apart from that, if it is of a nanoparticle size, they can enhance its the antifungal or antimicrobial activity. So that is another thing. And apart from this, the size, high surface to volume ratio, and the unique optical properties also helps the plant to react more easily. And apart from that, it is environmentally safe. So because of this, the chitosan is prepared to make a chitosan nanoparticle. So the chitosan nanoparticle can be prepared by, that is, physical and chemical. Generally, the physical methods by reverse micellar and sieving method and spray drying method can be done. And in the case of biochemical method, it can be added to the, that is, sodium tripolyphosphate, that is by inotropic gelation. And apart from that, precipitation, emulsion, cross-linking are also used for the preparation of chitosan nanomaterial by the chemical method. So we are in the lab, we first report on the biological preparation of chitosan nanomaterial. So in the case of chemical method, a generally used method is the application of sodium tripolyphosphate. So the addition of sodium tripolyphosphate will allow the chitosan to form an electrostatic interaction and thereby forming the chitosan nanoparticle. So with this we just tried with the biological preparation of the chitosan nanoparticle by adding the anionic protein which is prepared from the endophytic fungi culture filtrate. So with this, when we add the anionic protein into it, it forms the that is chitosan nanoparticle, and it has a very good properties like the same whatever we obtained from the chemical method. So through this, the chitosan nanoparticle is prepared. So apart from that, we also tried the copper chitosan nanoparticle also. So the preparation of chitosan nanoparticle by the chemical method is given here. That is the addition of sodium tripolyphosphate in the following ratio. That is 1:3 ratio gives a best result, and the nanomaterials formed in this case were precipitated and freeze dried and used for further. So the biological method, we are adding the anionic proteins, which is prepared from the endophytic fungi culture filtrate. And when we add this anionic protein to the chitosan solution, it forms a colloidal substance, and the colloidal substance was centrifuged, and the precipitate were freeze dried and used for the further application. So they were characterized by FTIR, DLS, zeta potential, TEM, SEM analysis, and XRD analysis were carried out. So this shows the UV spectrum of the chitosan nanoparticle obtained by chemical as well as biological method. The upper one is the chemical method, and the down one is the biological method. In both the cases, the peak at 295 nanometer and peak at 285 nanometer is formed. This is a preliminary indicator that the nanoparticle formation is happened. And then next is the FTIR, the spectrum of the chitosan and the by the chemical as well as the biological method. In both the cases, you can see the major peaks at 16948 and 1527. That shows the chitosan polyphosphoric group of the tripolyphosphate and amino group of the chitosan interacted, and the amide and amino group at 1638 and 1154 peak. And in the case of biological material, that is the peak at 1602 and 1564 and 1403. The binding of the protein with the chitosan can be easily identified, as well as the characteristic feature of the amide and amino group at 1623 and 1157 is formed. So thereby we conclude that the formation and interaction of chitosan with the the protein whatever we have applied, we that is identified. And this shows the zeta potential of this dynamic light scattering of the isolated that is the synthesized nanomaterial. That is where you can identify the DLS as 83 nanometer with the polydispersity index of 0.31. That shows the monodisperse nature of the the nanoparticle. And apart from that, the zeta potential is observed to be minus 30 millivolt. This is the chitosan nanoparticle prepared through chemical method, and this is the nanoparticle prepared through biological method. Here also you can identify the size of the nanomaterial to be of 89 nanometer in size, and PDI with 0.225
interacted with this, and the encapsulation of the that is chitosan and copper. And this is the DLS and the zeta potential analysis of the copper chitosan nanomaterial. Here also you can identify the size of the nanomaterial was 88 nanometer, and the zeta potential was observed to be minus 29 millivolt with the polydispersity index of 0.45. So this shows again the stability of the nanomaterial synthesized. So this slide shows the TEM analysis and the ADOX analysis, which shows the presence of copper in it, and the TEM analysis shows the size of the nanomaterial is of 20 to 30 nanometer, and the ADOX analysis shows that the nanoparticles are rich of copper. And this is the XRT analysis, which shows that the synthesized copper chitosan nanoparticles are of that is crystalline in nature. And this is the again after characterization of the copper chitosan nanoparticle, then we checked whether it has the ability to that is to have antifungal activity against Pyricularia grigia, which is a pathogen which causes disease in rice as well as finger millet. It causes the blight disease in these plants. Apart from that, it has also some other host. So the nanomaterials we have prepared by chemical method, that is chitosan nanomaterial, by chemical as well as biological method. Apart from that, one copper chitosan nanomaterials are also prepared. So all these things we have analyzed for the in vitro application, that is seed germination, whether it enhances the germination of the seeds in case of finger millet, rice, tomato, chickpea we have analyzed, and all these things the results in the enhanced seed germination and also seed vigor index. So apart from this, the application of nanomaterials enhance the IAA production. This we have analyzed by HPLC and identified that the treatment of the nanomaterials to the seeds enhance the IAA production in the seedlings. So after the in vitro condition by checking whether it has an effect on the that is seeds, then we checked the these nanomaterials we have applied to the plants at the pot condition. We have optimized. We have used various concentrations to optimize the concentration, and also apart from that treatment, also we carried with different methods. One by seed treatment, another one with the foliar spray, and another one with the seed treatment combined with the foliar spray. And after this, we have evaluated the morphological parameters and the defense enzymes, whether it enhances the defense enzymes, and also apart from that the yield parameters. And we have checked the challenge infection to check whether it controls the disease or not. So this shows the that is the application of the chitosan nanoparticle and copper chitosan nanoparticle on plant growth parameters. It enhances the that is number of leaves, shoot length as well as the root length, and thereby the enhanced fresh and dry weight were observed in both the cases, in the copper chitosan nanoparticle as well as in the chitosan nanoparticle. But when we compare with the among the chitosan and copper chitosan nanomaterial gave the best results. So next one is the chitinase activity. These are the defense enzyme we have seen, because why we have analyzed the chitinase and beta-1,3 glucanases are the substrate for chitinase is chitin. The chitin is not present in the plant. So the if the chitinase is enhanced in the case of plants, then definitely it will have resistance towards pathogen, because the chitin and glucan are the major cell wall polymers of the most of the that is fungi. the chitinase is enhanced in plants, naturally it cleaves the chitin which is present on the fungal cell wall, and thereby naturally it will not allow the microbe to enter in, or it may not allow to grow further. So with that, we have analyzed the chitinase activity in leaves of finger millet plants, and the upper one shows the quantitative difference in chitinase activity in control chitosan nanoparticle and copper chitosan nanoparticle. In all the cases, when compared to control, there is an enhanced activity of chitinase was observed. So the down one are the enzymes localized on the SDS page, which shows different polypeptides were enhanced in the case of chitosan nanoparticle and copper chitosan nanoparticle treated plants at a different age level. And in the control, very few bands were observed, and in some cases the constitutive enzymes were enhanced, and also apart from that, new polypeptides were observed in the copper chitosan as well as chitosan nanoparticle treated plants. So this is the slide showing the activity of beta-1,3 glucanase in the leaves of finger millet plants. So the upper one is the quantitative difference, and the lower one is the qualitative difference in the localized on the gel. So in the quantitative as well as both the cases, we have observed the differences in the treated plants. So the treated plants showed enhanced activity of beta-1,3 glucanase. Again, beta-1,3 glucanase, the glucan is the structural polymer of the most of the phytopathogenic fungi, and hence the induction of these enzymes definitely will play a role in inhibiting the growth of the invading fungi. So the down panel shows the beta-1,3 glucanase localized on the native page. So various different forms, isoforms of beta-1,3 glucanase were localized in both the cases, that is copper chitosan nanoparticle as well as the chitosan nanoparticle. So when compared to chitosan and copper chitosan, more number of isoforms were formed in the case of copper chitosan nanomaterial. So this is again the protease inhibitor activity in leaves of finger millet, which shows the qualitative and quantitative differences. So upper one shows the spectrophotometrical analysis of protease inhibitor, which shows high activity of protease inhibitor activity in copper chitosan nanoparticle, and which also reflects in the gel, that is the SDS page analysis showed various new polypeptides on the that is in the case of copper chitosan treated plants, and in the case of chitosan nanomaterial also very few new bands were appeared, and also the existing constitutive one gets that is enhanced in the case of protease inhibitor activity. So this is the peroxidase activity in the finger millet plants, where you can identify both the cases, that is qualitative as well as quantitative. There is a difference. In the case of copper chitosan nanoparticle, the enhanced activity of peroxidase was observed. The peroxidase was localized on the native page on different age level. That also shows the variation which is observed spectrophotometrically. That is different isoforms of peroxidase were observed in the that is finger millet leaves. So since the enhanced activity of the peroxidase were observed, we also localized whether there is the hydrogen peroxide, which is the substrate for the peroxidase, was enhanced in the treated plants. So, and also apart from that, the hydrogen peroxide is considered to be the signal molecule for the stress factor. So we localized the hydrogen peroxide in the leaves of treated as well as the control plants. In both the cases, the enhanced hydrogen peroxide was localized on the leaves of the finger millet plants. The fluorescing substance, that is the color, you can identify the hydrogen peroxide, that is which is enhanced in the case of treated plants, whereas in the case of control plant we do not able to observe any fluorescent molecules. So this is again the polyphenol oxidase activity. This is again the stress released factor, that is the polyphenol oxidase is also another defense enzyme which play a role in controlling the plant pathogen. So this also enhanced in the case of finger millet plants. Both the chitosan nanoparticle as well as the copper chitosan nanoparticle enhance the the polyphenol oxidase activity, as well as the localization of polyphenol oxidase in the native page also showed several isoforms of polyphenol oxidase in the leaves of finger millet plants. So after that we analyzed the yield factors. So the flowering condition, that is you can identify the chitosan and chitosan nanoparticle and copper chitosan nanoparticle. When compared to control, there is a significant difference in the flower formation, that is the number of seeds under the seed, that is the seed setting is also enhanced in the case of treated plants. That is the enhanced yield was observed in the case of copper chitosan. So this slide shows the number of inflorescence, fingers per inflorescence, and the number of grains per fingers, and the grain weight, that is in grams per plant. So this shows the application of chitosan nanoparticle as well as copper chitosan nanoparticle enhanced the yield of the grains. But when compared to chitosan nanoparticle, copper chitosan nanoparticle gave the better activity. And we also analyze the copper content in the grains, and that doesn't shows any variation when compared to the control. In both the cases, the minimum level, whatever the copper content is observed. So that shows there is no accumulation of copper in the seeds. So then another set of experiments were carried to check whether the application of these nanomaterials they control the pathogens. So that is the challenge inoculation and the disease index. We applied the spores to the potted plants and allow the plant to grow for some times. And we have observed the disease and rated with the scales. So if it is there is no symptom, it is with a 0, and different affected conditions is with the scales of 1:1 with 1 up to 5 were noted, and the severity index was calculated using the formula. And this shows the symptoms of the blast disease affected by the Pyriflaria gracia in finger millet plants. So the control plant shows more infection when compared to the treated plants, both the case of chitosan as well as the copper chitosan nanoparticle. This shows a clear that is magnified view of a plant. We can show with the compared to control as well as the chitosan nanoparticle, there is less infection were observed. This is the copper chitosan nanoparticle, wherein also there is a very less amount of symptoms were observed. And this slide shows the disease severity index in control and nanoparticle treated plants, that is against the the plants challenged with the Pyriflaria gracia. The control plants nearly 100% that is affected the Pyriflaria blight, so blast disease was observed in the case of control plant. But whereas in the case of chitosan nanoparticle and copper chitosan nanoparticle, the infection was 36% in the case of chitosan nanoparticle, and only 22% was affected in the case of copper chitosan nanoparticle. So the apart from that, the disease also symptoms appeared a little later age when compared to the control. In the case of control, the symptoms appeared early, that is on the 15th day itself we can able to observe the symptoms. But whereas the treatment, the chitosan nanoparticle, that is the first disease symptom was delayed up to 25 days in the case of chitosan nanoparticle, and in the case of copper chitosan nanoparticle, the symptoms were very highly reduced and delayed, which is observed on the on the 35th day after inoculation. And also the symptoms was not that is increasing, and up to 22.6% only we have observed. So this was published in the carbohydrate polymers. So all these things results that is were from the potted condition. So we checked whether this potted condition, the results obtained from the potted conditions on the field trials also. So the field trials, for field trials, we have analyzed the seed application along with combined with the foliar spray. So here also we can observe the enhanced that is morphological parameters like number of leaves, shoot length, and fresh and dry weight. All the in all the cases, we have observed the increased growth condition when compared to the control. So this is again the plant which shows the inflorescence. In the case of treated plants, we can able to observe number of inflorescence were enhanced in the case of both the chitosan as well as the copper chitosan nanoparticle treated plants. So this is the detection of the chitinase. Again, we have seen different polypeptides of chitosan were enhanced in the case of field-treated plants. And also this is the chitinase beta-1,3 glucanase polyphenol oxidase peroxidase activity in the case of field-treated plants. And then the protease inhibitor are also enhanced in the case of that is field-treated plants. So the next slide shows this the yield parameter in the case of that is field-grown plants, where you can observe the that is in the control very that is the inflorescence were very small and the seed setting were high in the case of copper chitosan nanomaterial. This shows the whatever we have observed in the potted condition were also reflected in the field condition. This we have checked in nearly 2 to 3 times in the under the natural condition, and we have observed the enhanced yield in the case of copper chitosan as well as chitosan nanoparticle we have observed. So under the natural condition, we also checked whether there is any infection that is a natural infection that is which affect the plant growth and the yield, and the disease severity index again were calculated. This also shows that is the copper chitosan nanoparticle, that is the infection was very less and when compared to the control, where you can see the that is on 90th day 72% infection was that is disease index was observed. And the panel shows the that is the infected leaves in the case of control as well as the treated plants. So this is published in the Journal of Agricultural Food Chemistry, which is a ACS publication. So the summary of this presentation is we have synthesized the chitosan and copper chitosan nanomaterials. With both the nanoparticles enhance the growth of the crops, and the application of chitosan and copper chitosan nanoparticle induced various defense enzymes in finger millet plants. Application of these nanomaterials protect the finger millet plants even at under field condition. Nearly 80% protection were observed, and the application enhanced the yield nearly by 90% over the control. So this is what our findings summary. And the application of nano formulation requires very less volume only when compared to the conventional fungicides, whatever we are generally using. And apart from that, it is eco-friendly approach, and the whatever we are using is that is eco-friendly in nature and results in the enhanced food production, and which leads to the security and food safety also. And these are the challenges we are facing in this that is era due to the climatic changes. We have to go with the eco-friendly approaches, and the nano composite now we are doing with some nano composite preparation, and also we are looking for the biofortification in the millet plants also. So this is what we are doing. And apart from that, what I have presented here is the finger millet plant we have worked. We also worked with rice plant, tomato plants, chickpea plants, where also we have identified all these positive effects on the yield, as well as it controls the phytopathogens, and this is what the results we have obtained. And so I acknowledge the students who have worked with this work, that is Dr. M. Manigandan, Parthasarathi, Indumadi, and Muthukumar, who worked in this area, and the IITM and IAC for their that is characterization work. I utilized these facilities from IITM and IAC. And apart from that, for financial support from DST PERS, CSIR, and Bharatdasan University, I acknowledge. Thank you.
Thank you, ma'am, for the session. Now the session is for discussion.
Yeah.
Delegates, if you have any queries or discussion, now the session is open. Anshita Purohit, she's raised her hand. Anshita.
Ma'am, thank you, ma'am.
Yeah, thank you, Dr. Gayatri, for giving this opportunity. Thank you.
Thank you, ma'am. Nice presentation, ma'am.
Thank you. Thank you.
Thank you, ma'am, for the thought-provoking session.
Yeah.
Now we have come to the end of forenoon session, and I request the delegates to join the post-lunch sessions at 1:20 p.m.
Thank you.
Thank you.
Thank you, ma'am.
Thank you.
চাইছে লজিকটো তেনেকুৱা লজিক লাভ নেই 12টা 12টা বলছি দেখেন 12:30 স্বপ্ন দেখা বলছি
ভিডিওটা অবশ্যই না
মিনিমাম ক্লিয়ার ভিডিও মিনিমাম ভিডিও ওর জন্য স্বপ্ন দেখা লাগছে উনটা তো শুনবে ঠিক আছে
কিন্তু না অবশ্যই না
লাগাও কারণ আমি লাগিব নই মাথায় লাগিব হয় হয় আমার এই যে ডিজিটাল চ্যানেল দিয়ে আছে যে আচ্ছা ভিডিওটা কিভাবে অফ করা যাবে
हे कोणतं चालू आहे? हे कोणतं चालू आहे पाहू. तेच उपेंद्र सर बोलतो ना. आवाज कुठे आवाज आवाज कसा चालू करायचा हेच समजलं नाही. आवाजच कुठे काही सिट्रेंट असं काहीतरी नाव आहे ना बरं. हे बाई हेच ना. हे काय बर किती मी काय नसतं लिंक आली करून टाकतो. लक्षात ठेवत नाही काय नाही काय चाललंय.
Swati Joshi, ma'am. Yes, ma'am. Welcome, ma'am.
Yes, namaste. I'm
Namaste,
here.
ma'am. Yes, ma'am. Ma'am, let us wait for a few minutes, ma'am.
Yeah, sure. No issues.
Join. Yes, ma'am. Thank you.
Thank you.
Uma, ma'am.
Yes, ma'am. Shall we start the session?
Ma'am, Madam has joined. Swati Joshi Ma'am has joined.
Yes, ma'am. Shall we start, ma'am?
Dean Ma'am kita ஒரு வார்த்தை கேட்டுட்டு.
Yes, ma'am.
Ma'am, Dean Ma'am has joined, ma'am. Good afternoon, ma'am. Ma'am.
Ma'am, shall we start, ma'am?
Yes, ma'am. Yes, ma'am. Dean Ma'am join பண்ணிட்டாங்க.
Yes, ma'am. A very good afternoon. Today's first speaker post launches Dr. Swati Joshi, Scientist B, National Institute of Occupational Health, NIOH, Ahmedabad. Ma'am is currently working as scientist at ICMR, National Institute of Occupational Health, Ahmedabad. Earlier, ma'am had served as assistant professor at Central University of Gujarat, Gandhinagar, Gujarat. Ma'am's major area of research is microbial enzymes, particularly extramesomes, protein, and metabolic engineering and allied aspects, microbiology and biotechnology. She has earned her doctorate in microbiology from University of Delhi, South Campus, where working at the interface of microbiology and biotechnology and molecular biology. Employing next generation platforms, she focused on developing industrial strains of Pichia pastoris, Dr. Swati also contributed as principal investigator in DBT Biocare funded research project at CUG. She has published over 20 peer-reviewed scientific papers, reviews, and book chapters. There are 3 transcriptome sequences submitted in NCBI to her name. She has also been conferred with prestigious Dr. M.G. Thirumelachar Young Scientist Award in the year 2015 by Mycological Society of India and Young Scientist Award in the year 2018 by Association of Microbiologists of India. She is a life member of BRSI, MSI, AMI, and Indian Lichenological Society. Ma'am, now the platform is yours.
Thank you so much for your kind words. And first of all, I would like to take this opportunity to congratulate the entire team of Professor Vijayalakshmi ma'am. And thank you for...
No, first I should also invite you. Dr. Swati, I am very, very happy that you have come. And in future also, we will be sharing your knowledge. We will have cooperation and we will be coordinating, both of us.
I'm really honored and humbled by your invitation, ma'am. Thank you so much. And I really appreciate the teamwork is really going on very nice, because I was in contact every minute. So thank you so much for such support. So without first of all, I would try sharing my screen so that everyone can see the presentation. Just a second. I hope this is visible.
Yes, ma'am.
Okay. So, the topic that I've chosen for my talk is reference management in scientific publications. The other day I was visiting Avinashilingam Institute's website, and I saw that every science department is publishing so many papers, research articles, and recently many publications are in 2021, 2020, many publications are there. I was browsing botany department's website as well. So I found really interesting articles, well cited and well referenced articles. So first I take this opportunity to congratulate on that so good journal research article are being published. And so every academician and every researcher at some point or the other, write articles, write thesis, write chapters or books, and we tumble upon managing references, because all our work, all our manuscripts, research articles require proper citation of the work that we are referring, because references tells you that how your work is related to other literature and what is the foundation upon which you have built your investigation. So whenever we are writing a project, whenever we are writing a paper, we do thorough study, we do thorough literature survey, and we come across several interesting studies, right? We choose some of the studies to build a hypothesis on, to find the research gaps, right, where we can write a new project on, right? So at every stage of research, investigation, and any study, reference management is critically important. So in this talk particularly, I will be highlighting on what is referencing and what are the rules of responsible referencing, what is significance of referencing, right, and what are the different styles of referencing. And I will also point out some tools of reference management, and then I will give a demonstration of using EndNote for facilitating referencing. So first of all, question comes in our mind that what is referencing? So if I try to define in simple words, I would say that a systematic process of organizing the source literature so that it can be easily retrievable as well as citable. Right, retrievable by whenever we are doing literature study, we keep saving PDFs, we keep saving chapters, and a huge folder is created, right? And when we try to cite them, we need to go back to that literature. If we want to see something important, we need to retrieve that back, right? We may find it difficult when we have hundreds of referred materials, right? So referencing will help us not only retrieving the article very easily, and also make it possible to cite them in a very easy way. Okay, so how do we do that? I will shortly show you that how can easily we can manage references, how can easily we retrieve the references, among other things. So before jumping on to the next slide, we all should, being academicians and researchers, we should know some terminology related to referencing. Right, we come across references, we come across the term citation, we come across the term bibliography. So what does it mean? What exactly it means? Right? Is there any difference? See, there are different schools of thoughts that take referencing and bibliography as separate terms, and some people consider them as one. So if I go literally by one school, then references are the list of resources, I would say, list of resources that we put at the end of our article, right? We every time at the end, the article structure is like title, author details, then abstract. If I talk about a manuscript, then introduction, methodology, result discussion, and conclusions, and future perspectives, right? So at the end we place them, usually we place them at the end. So that whole list is considered as references. So we referred the article while literature survey, and we also use them while writing the manuscript. And what is bibliography? Some people consider it as all the referred materials while building up the manuscript or writing a project. Whether or not you cite it in the main body of the text or manuscript. So if we go by that, the bibliography will be longer list of references that we referred but not actually cited, right? So the bibliography will be longer. So, and what is the citation? Now citation, the list is citation, or the words or the numbers that we are writing in our manuscript is citation. Actually, the in-text citation that are coming into the main body of the article as well as at the end of the article. So together that will be called as citation. In-text citation, and at the end that you have as a list in the form of a list. So there is a bit difference. You can choose any term, bibliography or references, but you should know the difference in reference and bibliography, right? So moving forward, I have shown here I've taken this example. This is a research article, and I've zoomed in to show you how the numbers are showing you the in-text citation. This is there are different styles of citation. We will shortly know that what are all those styles. Sometimes people write author year combination, or sometimes according to journal or according to the requirement of the syntax. We either write numbers or we write author and year pattern, or that sort of style we use. And at the end we have a list of references. Here, because references are numbered, the in-text citation is in the form of number. So when you click on 10, 13, 19, you will go to that particular reference. So in-text citation and list of references together is citation. Now we also should be aware of how many types of citation can be there. And we should be really vigilant, and we should really be not casual for citing these sources. Primarily, there are three kinds of sources that we cite: primary sources, secondary sources, and tertiary sources. What do they mean? What is the primary source? Or what is the secondary source and tertiary? Primary means the raw data coming out of the research. Raw data that is coming out of the research, and first-hand information, first-hand observation, first-hand viewpoints coming in real time at that particular time. So all those sources, all the information coming in that form is primary source, right? And mostly we should prefer citing primary source of information. right? Not the secondary or the tertiary. Now, what is secondary? Secondary means, say someone has analyzed the primary sources, has compiled and tried to interpret the primary data in newer form, right? Or someone has reviewed many papers, someone has done a critical analysis of many primary sources and have come up with a new interpretation. Biographies, journal articles, textbooks, commentaries comes under this category, right? And tertiary sources that compile data on a particular topic, right? Collection of lists of primary and secondary sources. So tertiary sources are compiled from the literature of secondary sources. So whenever we cite an article in our manuscript research article, we try to cite primary sources. And sometimes what do? Say, for example, I have written as well here, that we want to cite Ramya's work, right? But what are we doing? We are citing Nidhi's work where Ramya's work is mentioned, but that's the wrong practice. We should explore more and we should reach to the original primary source that Ramya has produced. That knowledge should be cited in our manuscript. So that should be, important point kept in our mind while making proper citations or references. Now I would like to tell you about 10 golden rules of responsible referencing. A very powerful statement was made by Bart Panders that a well-referenced manuscript places the author's argument in the proper knowledge context and thereby can support its novelty, its value, and its visibility. Right? Why citation is so important? Why citation is so important to us or for anybody? Right? In the world of web, everything is interconnected, and visibility of your work is dependent on how your work is linked with the work of others. Right? Whenever we cite many references or many articles in our work, we automatically link. We create a web of string that link our work with others' work. Right? So if we cite well, if we cite proper references, then the importance, the visibility, and the power of our work will be realized. Sometimes, if we don't follow or we don't responsibly refer or responsibly cite, then we may inflate or deflate the value of citing. So 10 golden rules. I've taken these rules from Bart Panders' article, and these I really like to always take care whenever I'm writing an article. So first rule is that always include relevant citations. So relevant citations means that the work on which your work is based, or the or the work that are closely related to your work, so that a proper connection or proper link can be set. So those citations only be referred or finally cited in your main manuscript, right? And the error that we usually do, what do? We search thoroughly, we do literature study, but the error that we do is we don't study the article to completion from start to end. So we just read the abstract, take an overview and just blindly cite it. Okay, somewhat it is related to my work, it can be connected. No. Sometimes when you go through the manuscript, you will realize whether it is actually related to your work or some connection is there, whether it is supporting your argument or it is opposite to your argument. So we always should read the publication to completion, or we should read till the end, right? And also we should take care that the content in the referred article is appropriate or not. Okay, So you are the judge at that moment. You will judge that article that you are citing, right? So whether the content is accurate, whether it is actually error-free, so that should also be kept in mind. And we should also cite transparently, not neutrally. We should not be biased while citing, right? Sometimes people use different terminologies while referring or citing a work. Like if I put in very, very simple word, an extraordinary work, if I use very simple words for an extraordinary work, then I'm not transparent. I should give due credit to any article while I'm citing it, neither inflating nor deflating its value. So that should be always kept in mind. And the next point, which is really important, cite yourself when required. Self-citation, sometimes it is discouraged, but it must not be when it is a must to cite yourself. When your study is building upon your previous study, or it is adding some value, some new knowledge to your current study, then you should cite that. You should cite yourself if it deserves due citation, right? Just to increase the number, just to increase the indices that, okay, this is my work, I should cite this. Whether it is related, whether it is in accordance with content or not, whether it is relevant, we should always keep that in mind, that it should be relevant, then only we should cite ourselves. Otherwise, you may fall prey to the self-plagiarism, right? That's really important. Right, and then we should prioritize the citations that we include in our presentation. Why prioritize? Say you have referred hundreds of articles while you are writing your manuscript, or when you were making your project, writing your project, right? But sometimes journal to journal, publisher to publisher, the number, they restrict the number of the references that you can include in your manuscript or in your project. For example, Nature Communication allows you to include only 3 references. How will you choose those topmost 3 references that you can include in your article? Or from my field, if I take an example, Bioresource Technology is a journal that limits the number of references that you can add or include in your citation. Reference is 35. So you need to prioritize. You need to exclude the irrelevant or not very much relevant. So only you need to prioritize. So how can you do that? You can do that with ease, because we know the articles are structured, right? So in each, we can prioritize references for each section, or we can choose another way to include as much of the text as supplementary, so that most of the references will go in the supplementary material. So that will limit the ultimate number of citations. And also you will have to exclude because we are all human beings, we might err, we may be biased, right? So we need to be very transparent, very judicious, very rationally we should include the references in our manuscript. So these 6 points that I've given just now, these are for those who are writing projects, who are writing their manuscripts. But now 7 through 8, these are the points when to consider when we are reviewing others' work. Right. Say, for example, I'm reviewing someone's work. I should be blind. There are different kinds of review processes, double blind, single blind, and many others. So the process itself says that you should be blind. To what? You should be blind in a way that you are not biased. You should see the article you are reviewing as neutral you can be, as unbiased you can be. Right? So evaluate citations as the choices that they are. What does it mean? It means that in different disciplines, in people from different cultures have their choices. Every person has a different style of choosing something. They muster all their potential and they make decisions about how you choose your reference, right? To validate their own work. Right, so that bias, all the people are biased. So you should take those references as choices of people, right? And also should evaluate in their rhetorical. What does that mean? You should neither give more importance to an article cited, nor the less. Right? The due credit should be given. And because we frame the article, right? We frame the sentences, sometimes to be paraphrase the sentences, we include some references, we exclude some references. So we frame our sentence, we frame our paragraph, we frame our article, right? So we fit it according to the guideline of a journal, right? So we should evaluate them as framed also, right? And we should also accept that citation culture in different disciplines or across different disciplines is different. There are boundaries, like in science, in life sciences, in biology, in physical sciences, in chemical sciences, in literature, in history or languages. The citation number of citations is not the same as in a particular field. What do I mean by that? I mean that some journals, some fields are really well cited, right? They receive a good number of citations. Their impact factors are so high, right? But few other journals like languages, humanities, education, they might not receive as many citations as sciences are receiving. So we should not devalue a journal or an article which is published in a less impact journal, right? Because it is different field. So they might not receive that many citations. So we should respect and accept that boundary. Okay, so that is also a point I wanted to put forth. So as authors and as reviewers, we should keep these things in mind, right? So that we can responsibly write, we can responsibly evaluate others' work. Now, moving on to how actually we write these citations, or how do we refer? How do we make our citations? So what the elements that are required for citations are that you should know who is writing, what is being written, when is it written, and where it is written or published, right? So I hope the slides are moving. Is it? I am on slide number 8. Is it?
Yes, ma'am. It's moving, ma'am. Yes, ma'am.
Okay. So we should know that who is writing, what is written, when it is written, and where it is published. So these 4 elements, if we know, we can write or we can cite properly. Right? For example, here I've shown the elements of reference entry. Like there is author name, there is the title of the article, there is journal name, year of the publication. So who, what, where, when, right? And also some other information like volume or issues and page numbers. And for e-journals, you have a DOI, or you can include a URL as well, right? Depends which journal you are publishing in, where you are sending your article to publish, right? So these are the basic elements. Whether it is humanities research article or science article, you will have these elements for sure. Now, what constitutes a reference? Whether it is only scientific articles, or the other materials can also be cited. Yes, other materials can also be cited, like books, book chapters, atlases, newspapers, videos, social media content. Everything can be cited if you have the 4 elements with you: who, where, when, what, right? So it can be cited. Now we should also know what should not be cited. Common knowledge, results of your own study, what you are actually writing the manuscript on, and your own interpretation of other study that we usually include in discussion part of our article, right? So those things are not citable. They are not cited. And where we should compulsorily we have a reference in our manuscript. All the statements that we make should be cited. Results which are not based on our studies, which are other results, should be cited. Any specific method that you have used, or anything that might fall under plagiarism. I was really happy when I saw the schedule of this program. There was a special lecture set aside for a very very important topic of plagiarism, right? Which is actually a crime in academia and anywhere, right? You get penalties, huge penalties are there nowadays, right? So you should refrain from plagiarism. So that referencing also helps you to avoid, plagiarism. Now, what is the significance? Why are we citing? Why are we referring? And why are we are interested in citing others' work? We want to give due credit, whatever we have referred to. That not only gives you, your research visibility and value, but also shows the author's intellectual integrity, right? Being in academia or in research, we are more responsible than others. We should show integrity, right? In every aspect of life, we can set examples, right? So in writing also, we need to be very honest. So referencing properly shows your intellectual honesty, that you are giving due credit to the research that is previously done, and you give due credit, you respect their work, and you properly cite them wherever it is required, right? And you avoid plagiarism, right? You avoid disciplinary action against you, right? So that is another benefit to the author. And also it helps your audience, it helps your readers to track the research work upon which you have built your work, right? So it helps them to find the original work, right? And also it relates or attribute the prior work to correct sources. So that is another benefit. And because a proper referencing will support your argument, right? Whether you may discourage the other's idea, you may give a new conclusion, you may add new knowledge, right? So that supports your argument. The proper referencing supports your argument. So that's really critically important. And also it allows readers to gauge the strength and validity of the material that is being used by you, right, as an author. So whether you are properly cited, it will add to your credibility as an author, as a researcher, as an investigator, right? So we should always be referencing properly. Like, as I was telling you that plagiarism is really a menace and we should avoid that. And UGC, the premier organization, has given time to time different regulations. Recently in 2018, there was a regulation to promote academic integrity. Now you see, academic integrity and prevention of plagiarism in higher education institutions. So it's really important to cite properly and give due credits to others' work, right? And in addition to that, UGC publishes time to time different guidelines, right? Different notices to avoid self-plagiarism as well, right? So we should responsibly cite our own work, not just vaguely, right? So it may, being biased, cite yourself to get higher indices, H index, cite an index, altmetrics and whatnot, right? But when critically analyzed, these self-plagiarism will not fetch you any valuation and will not add any marks to your credit. So we should refrain from all these malpractices. I think this is already covered in your, I think yesterday it must have been covered, like that how to, avoid self-plagiarism, right? The only point that I would like to focus here is that what we should not do, right? Sometimes, people tend to, what do? They split their one big study in different parts and they try to publish it as separate articles, right? That is entirely wrong. So we should refrain from that, because you can always publish your work in a good journal if the study is really intact and giving some good new knowledge to the society and readers, right? So we should not do that. Now, there are different referencing styles. You might be aware of these. There is Modern Language Association, American Physiological Association, Chicago, and Institute of Electrical and Electronics Engineers, CSE, whatnot. There are many, right? And these styles are mostly used by particular disciplines, like MLA is used in case of English literature, foreign language communication, religious studies. All those manuscripts and articles on these subjects use MLA. In psychology and education, APA is used, right? So different disciplines prefer to use a particular style. And you will find a wealth of information. Many blogs are there, many videos are there, many good books are there that can be referred for a proper citation in a particular reference style. So I will suggest and I will urge all of you to go through these references and standard guidelines for any particular style that you are choosing to use, right? And here I've taken an example to explain you that how this it can be presented in different styles using those 4 elements: who, what, when, where, right? So this APA style, is it visible? Slide number 15 is visible to you all?
Yes, ma'am. Yes, ma'am.
Yes, ma'am.
Okay. So here, single reference. First example is in APA style. So here, author's names, surname, then initials, and then year in brackets, and then in sentence case, the title of the manuscript and the journal in which it is published in italics, and then volume number in italics again, and in bracket you have issue and then the page numbers, right? And in IEEE style, you number your reference. First you write the initials and then you write the surname, like that author's name goes, and then in inverted commas the title of the article goes, and then non-italicized way the name of the journal, volume number, issue number, page numbers, and then year. So you see same information in different syntaxes, right? So there are other styles that are using the same 4 elements and presenting them in different styles or different syntaxes, right? So this way we can appreciate different styles of referencing, and we can choose them easily if we know the syntax of how to cite a journal article, how to cite a book chapter, how to cite a book, newspaper article, and many others, right? So to manage references, we have many reference management softwares. Some are freely available, some are paid, and also can be, institutional subscription can be taken for some, right? So like Zotero, Menly, EndNote, these are the popular ones. So we can always go to these softwares and help ourselves in managing references, right? At the end of the talk, I will demonstrate how to use EndNote. Now I'll go very bit quickly that how to cite a journal article. This is the syntax in the blue I have given. The author name, author surname, initials, and then year in brackets, and title of the journal, and title of the periodical or journal in italics, then volume number in italics, issue number in not italicized in brackets, then pages, and then the URL or DOI, whichever is asked you to include in your reference. So this is the syntax, and you can always, based upon that syntax, you can cite the article. Here you see, this is the article cited in the same pattern as the syntax. Name of the, surname of the author, initials, and then again, all the authors are cited, including this N symbol, then brackets, year in the brackets, right? The article title, journal in italics, and then volume, issue, and page numbers and URL. Like that, we can cite an article in APA style. Similarly, there are syntaxes available for book chapter and books, right? So for book, this is the format. If it is an hardcover book, you will have to use last name, then initials, year, book title in italics. And if it's a translated version or edited version, then you will have to use the name of the translator or editor. The initials you will use first, and then last name, and then you will write editor if it is a ED, if it's an edited volume or trans if it's a translated book, and then which edition it is and the name of the publisher. So here you see whatever information you have, you can write accordingly, but you have to follow the syntax. Now in text citation, you know that APA style is a parenthetical style, and you write author year pattern, and if the page numbers are required, you can include the page number as well. Likewise, we have formats for ebooks where you will include the URL and DOI as well. Similarly, book chapter syntax can also be followed very easily, and parenthetical style you can cite the in text also, right, including the page number. Now here I've shown you how to cite a newspaper article. Here I've included the example of an e-paper. So who, what, when, where. If I zoom in for this article, it is written by DNA Web team, edited by Sampa Sen. So this is the author, this is the source, and this is the date and timestamp. So whenever we are using or citing a e-material or from e-newspaper or e-magazine or any other e-content, we mostly need to use the timestamp also, right? So syntax in APA format for an article in e-paper is author name, surname, and then initials, year, month, and date of the publication, article title, newspaper title, and followed by retrieved from newspaper homepage URL, right? And timestamp can also be included. As I zoomed in, and Shampa Sen is the author. So first of all, Sen S. Then it was published in 2021, August 3. So date, month and date. Then title of the article and newspaper in which it is published and the URL of the newspaper. And inside or in-text citation is Sen 2021, right? I hope I'm audible and clear.
Yes, ma'am. Please go on.
Okay, that's good. So, how to cite a newspaper article that is in print. So if you are using a print media newspaper, so you'll have to include the page numbers also. And this is the format for newspaper in print. You will have to have an author name and then initials, year, month of date of the publication, article title, newspaper title, and page numbers, right? So I am sure that if you follow this syntax, you can write and you can cite any newspaper article in print also. And for in-text citation, the same thing, parenthetical, author date or author year pattern with, if you have the page number, then page number also. Now, how to cite a video? Right, nowadays people are using different video platforms they make short videos, they upload them, and people use them. They are sometimes telecasted on news channels, or sometimes they are referred in the articles. So whenever we are citing a video, how to do that in APA style, right? So some things, what is it, who published it, which website it is published, what is the URL, what is the date, and what is the timestamp. If you have all this information, you can easily have the citation. So author, then director or the publisher, director or the, here director will be who has uploaded the video, right? And then the year when it is uploaded, title of the video, subtitle if available. Then in bracket you will write video. What is the type of this reference? It is a video you are citing. Website or publisher, then URL. Right. I have taken the example here. So if I zoom in for information, more information, this is a video titled India, and Memorias de Oriente is the uploader, means author, and it was uploaded on Saturday, September 25th, 2010 at this time. Okay. And some more information is there, which I actually don't need here to cite it. So I have written the author's name, okay, then year, then what is the title of the video, and what it is? It is a video. What is the platform or website? It is a Vimeo website.
Ma'am?
Or publisher is the Vimeo, yes?
Ma'am, it is showing, okay, now the slide has changed. Okay, ma'am.
Okay, sorry. Is it visible?
Yes, ma'am. Now it's visible.
Okay. So as I zoomed in, I could see all the information, and then the author name, that is Memories d'Oriente, then year 2010, video title is India, and again in bracket I have written video, and Vimeo is the publisher who has published this video, and then URL where I can find this video. So this way I can cite this video as well. And in-text citation, again the same, because I'm giving you examples of APA style only. So author name, then year, and the timestamp, because sometimes now you see the importance of timestamp here. Say for example, it's a 3-hour long video, and I'm just citing part of the video starting at 140 minute to 240, 1 minute video I'm citing. So at that time, you need to have the timestamp, right? Here I have written the timestamp 140 to 240, right? So this way we cite the video in any of our articles. So if you want to cite a YouTube article, then what will you be requiring? Right. Again, the same question you will ask yourself, whether you have the knowledge about who, what, when, where. Okay, you have it, then you can do it. So format of citing a YouTube video in APA, because YouTube is a really big source of information nowadays. So people do cite YouTube videos as well. So this example I have taken, which is, if I zoom in here, I see that this video is from iBiology. The publisher, the author is iBiology because it has uploaded this, and the title of this video is The Most Beautiful Experiment by Messelson and Stohel, right? So what is the time and date? Okay, it was premiered on 19 November 2020. Okay, so if you want to have timestamp, then you can include the timestamp also. So iBiology 2020 November 19, and the title of the video, and what it is, we should know the descriptor as video. It is a video, and who is the publisher? YouTube is the publisher, or the YouTube is the website, and then follow finally the URL. You will have to write the URL also. So this way you can cite your YouTube video also. Now, if you want to cite an article from a website, this is really important. And the important point here is that e-content keeps updating with time. Say if I have accessed a website today, it might not look same tomorrow, right? Because people are updating it, they are changing it, right? So whenever we are referring a web article, we should instantly download it, save it, and note the date and time, right? Because that is important. Because maybe if you want to refer back, if you have just the link, not the whole article, then if you go back to the same link, you may not find the content what you refer to, right? So whenever you cite or whenever you refer an article from a website, you should download that, or you should at least copy that, right? And keep it in the form that you referred, because it might be updated, right? For example, in APA style, this article I want to cite. The title of the article is Vidya Kaushal, right? And if I zoom in, I find the author information as well. Okay, this page is created by Sumati Govindarajan at this August 1, 2021, and this time. Okay, now what I need, the author, I have the author. Year, I have the year. The month and the date, I have. What is the article, title of the article? Vidya Kaushal. Who is the publisher here? Wikaspedia is the publisher. And I have the URL also. And in text citation, I can just simply put the name of the author and the year in parentheses. Right? So it's really simple, but the important points you should always keep in mind that download it or copy it at the time you refer, because maybe next time you go to the website, you may not find that content. Right? So next is how to cite social media content, right? I'm sure that you have heard of altmetrics, right? This tells you how well your work is cited, or how many times or how much your work is mentioned in social media, right? You have Twitter, you have many other platforms where people keep, typing, referring, citing others' work. So if your work is cited there, you get a high altmetrics, And nowadays, like H indices, I-10 indices, along with other health metrics is also important, right? So how to cite material from social media? I've taken an example from APA, that is American Psychological Association itself. It's their Facebook page, and they have made a status update. So what do you need to cite this? You need the author name, its name and initials. You need year and month and day of the publication. And you also need the first 20 words of the post, right? And also, what is the multimedia aspect? What are you citing? And what is the type of the post? What is the site where it is? And also the URL, right? So if I take this example of American Psychological Association, the name of the author will be only this, American Psychological Association. If it had been a name of person, we could written the last one initial. But it is an organization, so whole name followed by year and month and date and first 20 words of their post. And what it is, they have posted a link with thumbnail attached, so that information. And it is an status update. And on which site it is on Facebook, and the URL of the link. Right, so this way easily you can cite social media posts as well. And in-text citation, author and the year in parentheses. So name of the author is APA and 2020 is the year in parentheses. So easily you can cite it in text also. Was it visible?
Yes, ma'am.
Okay. Now I will take an example and I'll show you how to manage references with EndNote. Here I will show how to import references from an online database, first point. Second point, I will show how to create a custom group and add references to it. Third, I will show you how to find full text to download PDF for references. Third, I will show you that how to insert the references in Word document, and then to format a bibliography, and how to add page number to your citation. Right. So for this, I will have to probably switch the screens. Now I will share my entire screen so that you can see the process of using EndNote. 1 second, I'm stopping the presentation. Can you see my entire screen?
Yes, ma'am, we can.
Okay, that's good. So this is the EndNote version X7 I have opened, and I'm on this online search mode. Can you see online search mode? This one, my cursor is on online search mode, right? And just to show you the example, I have a Word file also, where I have typed some text. Say, for example, it is my manuscript, okay? So, and also I have a group here, EndNote X7, okay, that I've already clicked on that, this one, EndNote X7, right? So from home group to EndNote, now I'm on this Word file, right? So now going back to EndNote, I'm on online search mode, right? So now there are different databases that you can choose. There is PubMed, there is Web of Science, and number of options are there that you can choose your that you can search your references or citations from. Right. So for time being, I'm on PubMed. I'm looking for publications or references in PubMed. Already I have some publications here. I will delete them just a second. Okay, 1 second. I'll first, what will I do? I will just. Yeah, it's cleared. Earlier I searched something, for that that search was showing already. So now we are in PubMed. Okay, so remote library of PubMed we will be searching, and there are many search options. You can search by title of the article or journal and many other language or any other author. You can search by any. You can even add some more options to restrict your search. Say for example, if you've added title and also the year, then your search will be narrowed down. So just for purpose of demonstration, I'm choosing only one. I'm creating my search using title. Your search word should be very appropriate. Otherwise, you will get too many references or too less references, and that we don't want. Right? Say for example, I search for biofuel, right, and enter. So this PubMed library will be searched. Now the search is complete, and it is showing that there are 1,625 articles are retrieved. So whether we want to see all these articles or not, as it is a demo, so I will limit the number to 100. Okay, so I'm asking the server to show me only 100 articles. Okay, I'm clicking on the okay, so it will show us 100 publications. Just a minute. Yeah. So you see, it is showing us many publications. Right, so we have retrieved many articles from PubMed. Now, because this is a local source of these articles, and if you close the endnote, these all will be gone, and I want them in a permanent folder. I don't want to do this search again and again. Okay, so I will make a group. Just a second. Not showing that option for some reason. 1 minute. Actually, this icon shows you this is not active. Otherwise, you can create a separate group. Once you click on the create group, here you will see a group and you can rename it and use it for future use. Okay, so I'll directly go to adding references to this text, right? So here I've placed my cursor at the end of the last sentence here. Can you see? Here it is. Okay, now I have kept this instant formatting on. We need to keep it on so that a list at the end is automatically created. And also I've chosen the style of reference that I want my references in. I already want this in APA style, so that all that manual labor I will avoid by using EndNote. Say for example, I want to cite 4 references here. I can choose 1, 2, 3, and 4. I think I will have to create a group. 1 second. I'll stop sharing for a minute. I'm doing the same exercise again. For some reason, I was not able to make the group. So I am removing that and making a new search. Is it visible? My screen is visible?
Yes, ma'am. Yes, ma'am.
So I have gone to this local library mode. Okay, this book set icon is you are seeing. I have gone to this one. Okay. Now I select everything, Control A, and I create a group. Create group. And now new group I want to name. So demo. Okay. So new group, to this group I will transfer all the citations, copy and drag. So here we have many citations now in our group, which is a permanent folder for us. Right, and now I'm going to this Word file again, and I've kept my cursor at the end of the sentence. And say, for example, I want to cite 1, 2, this latest article, and this one, and also this one. And this icon you are seeing, insert citation. So I simply click on that. And this is importing the citation. See, I included 1, 2, 3 citations, right? Not only these are in my text now, but also automatically a list is created, right? That too in APA style. So now how much manual labor we have avoided, right? So this way we can use these softwares to make the process simple, right? So this is clear, I think, how to import the citation from creating an EndNote library, making a permanent group, and then importing the citations where you want to cite them in the style of your choice. I think this is clear. Okay, if so, now one more thing I want to tell you right away, that if you want to say, for example, in some particular citation, you want to add page number also, because this is a requirement for the journal you are publishing in. So you can do that here itself. So I've kept my cursor here at third citation, and I will go to this edit manage citation. And it will give me this window, and here for timing I'm writing a random number, say for example 12. So it will add this number also to the citation, in text citation. Okay, my cursor was at wrong place, probably that's why it got cited with the first citation. Okay. So you need to keep your cursor at right point, and then you click on to edit and manage citation. So page number, here you can see this page number P12 is included. So this way you can include page number also. Now one thing is that we need to have all the PDFs, right? Sometimes we search a particular or one article at a time, so that takes really a lot of time. So if we want to search PDFs for all the articles that we are citing, say this list shows you the citations that you have included in your article. So, and you want the PDFs, right? Hard copies or soft versions, whichever is available. You can do here in EndNote itself. I'll show you how. 1 second. One second. Huh? So here I've selected all the references that are in my article. And here you see a tab, Find Full Text. So you click on that. And just a second. Control A and Find Full Text. Here you need to click. Okay, and okay, because not all the articles are open access, so it is asking you whether you have subscription or of your institution has subscription or anything. But we click it OK because it will show us the open access articles only. So it is doing that for us. It will take a minute. See, it's searching. Here is searching and it has found URL of 2. It is still searching. It has found PDF of 1. It is searching all the folders. Okay, for all the articles. 1 second. So out of all these, it has found a PDF of 3 so far, right? We will have to allow it to complete its search. Sometimes if you have accessed, if you have referred older or open access journals only, many of the right away, because I've done a random search, and the articles are year 2022 or paid journal articles, so probably that's why it's not showing of many. Now whichever article is it has retrieved the PDF of, will show a paperclip sign. 1 second, it is still searching. So a paperclip sign will appear just like this. A paperclip sign will appear if you will click on that paper clip. Here you will get the PDF. Okay. So just a second. Let me see if paperclip is appearing. Now it has found a PDF of 4. I'll see. If I click on the PDF found article, so these are the 4 articles that it has found PDF of. So if you click on this and you click on the PDF icon, you will have the complete article in the EndNote, and you can download it from here. So you would have probably searched individually for all these 4 articles, and you would have looked for it, whether it is open access or not, right? So if more and more articles are available, it will give you the PDFs. Now it has found 5 PDFs, right? It is still searching. So you will get, say for example, I'm clicking on this article. So PDF of this article is also available right away. So this way your job gets easier with the software. I think it is clear to you all that how we can use EndNote for making a search, for making a group, for pasting, retrieving those references into your Word file, right? And also you can change the style, right? I chose APA, right? You could have chosen Chicago or any style, whichever is required. So this way EndNote makes your job really easy. It is still searching and it has found 7. Okay, it will find more and more, but I'll end the demo here. 1 second. So I hope I could do the justice with the topic given to me. And if you have any questions, I welcome. And I thank again the organizing team led by Professor Vijayalakshmi ma'am. And thank you for the invitation. And thank you all the listeners for patient hearing. Thank you so much.
Thank you, ma'am. Now the session is open for discussion.
If you have any questions, we can take them.
Ma'am, few questions they've posted in the chat box. One of it is, why different style is needed when we need to give same information? Can there be universal format for all journals?
Really interesting question it is, that what is the need, right? So I think answer to that would be sometimes when you retrieve the information from cited article, the pattern varies, right? The pattern varies, and journals and publishers are sometimes specific for the style they want to have. So I think there won't be any justification or being a science person, I don't find any logic in having so many styles. But we will have to do it because, you know, editors are having this restriction for authors.
Then another question is,
Yes.
what is
This was very relevant questions. Why do we have
reference management?
What is meant by reference management, right? I remember when I was new while doing PhD, and my supervisor asked me to write a chapter and review article. I was manually managing the references. Managing means, say for example, you have a list of 500 articles, and you want to cite them in text, and they also be present in the reference list. So back and forth, you will go and come, whether you have cited this, whether it is in the list, whether all the 500 are in the same syntax, whether I've done the error of a comma or a full stop, or I have not italicized particular Word. So that management, proper citation in accordance with the guideline and syntax is reference management, to not miss anything and to include a complete citation. So that is reference management. And when you do it manually, it's really laborious. I had done this in the beginning of when I was just started the PhD. So I was doing it manually. Then I was scolded like, what are you doing? Why are not you using OneNote and other softwares? So if you are spending 5-6 days, so the time is money, right? Time is invaluable. So you can't waste so much time in just managing references. I think that's what time management, reference management comes into picture.
Another question.
I hope
one more question.
Yes.
What is your opinion on use of Google Scholar for managing citation format?
Yes, please.
What is your opinion on use of Google Scholar for managing citation format?
Google Scholar?
Yes, ma'am. That is the question they've put in the chat box.
Okay. I may not do justice answering this question because I have not used Google Scholar for reference management. But when I try, and then only I will be able to answer. I have not used Google Scholar, so I may not be able to answer this. Google Scholar for reference. I will see it. It sounds interesting. I'll see that how this can be done.
Yes, ma'am. Any other queries?
I maybe send answer to Gayatri ma'am or Nisha ma'am, so that they can later give the answer to audience. I will explore it and I will forward it.
Yes, ma'am. Any other queries? I think there is no queries from the delegates. Ma'am, we sincerely thank you for taking out time from your busy schedule to provide us with such valuable information. Thank you, ma'am.
Thank you, ma'am,
Thank you.
for a very informative session.
Thank you, Nisha ma'am. Okay.
Thank you, ma'am.
Okay, thank you.
Good afternoon, sir.
So kindly unmute yourself, sir. We're not.
Yeah.
Yes. Our next session is on statistical methods in research by Dr. Balasubramanian, visiting professor, Kerala University.
Shall I move on, madam?
Sir was previously retired professor from Kerala University. Currently, sir is visiting professor and guest professor at Chennai. And his previous experience is at Aquatic Biology and Fisheries, University of Kerala. He has 33 years of regular service from the year 1975 to 2008. And from 2008 to 2013, he was visiting professor for 5 years. And sir is teaching in research and biostatistics. Sir has handled varied classes for MCA and MBA with probability and statistics for management. And Sir is Professor Biostatistics at Central University of Kerala, Kasaragod. Currently, Sir has been visiting professor for various nursing colleges at Chennai and teaching biostatistics, applied statistics, and nursing statistics with research methodology. Sir, now the platform is yours.
Good afternoon. Hello. Shall I move on, madam?
Yes, sir. Please kindly move on, sir.
Now, congratulations, Dr. Anita, Dr. Manimeghale, Dr. Uma, Dr. Maheshwari, and team for organizing this 6 days training program. Really a grand knowledge feast, in fact. My sincere thanks to you all for giving me an opportunity to speak on this occasion. Now, all dignified faculty members, researchers, and students, I'll be sharing a small account of commonly used statistical tools in research. So straight away I'm moving. So I'm sure you will be able to see this, right? Hello, yes?
Yes, sir. I can see it, sir.
Okay, okay. Now, as you consider biostatistics, you have two branches, in fact, main branches, descriptive statistics and inference statistics. Now, descriptive statistics we use to summarize our data numerically. And then the inferential statistics, a random sample of data is taken from the population. And using this, we make inferences about the population. Now, in a particular study, when we collect data, you will have the qualitative data having no numeric measurement, and then quantitative data having numeric measurements. You call it variables. Now, this is important because the data collected must be distinguished based on their scale. Now, statistical methods will be different for data with different scales. Now, this will give you an idea how the scales are coming. The nominal scale, ordinal scale, interval scale, and ratio scale. Nominal scale, the name or category will come there. Examples are gender, color, religion, and all. Ordinal scale, actually we rank the data in a particular order. Now the examples are stages of disease, severity of pain, level of satisfaction, and all. Interval scale, actually by how many units one differs from the other. So mainly temperature comes under that. And the ratio scale, by how many times one will be bigger than the other, say the length, weight, and all. Now, the distinction between interval and the ratio scales can be ignored in statistical analysis if you want, but the distinction between the ordinal and nominal data are important. Now, all central measures, dispersion measures, Pearson's correlation, regression analysis, and all parametric tests are possible for ratio scale data. Non-parametric data or non-parametric tests can also be used for ratio scale. But for ordinal and nominal data, only non-parametric analysis possible. For nominal data, only chi-square analysis is possible. No central measures, no dispersion measures possible. Data can be presented in percentages. Now for ordinal data, chi-square test cannot be done, and median can be used as a central measure. No dispersion measure possible for ordinal data also. Now, for demonstrating some results, I have used an online software which is bazaarstats.net, and this is actually very simple and user-friendly, and data analysis possible even in a mobile phone, and a good number of parametric and non-parametric tools are available in this. But the only thing is that data size cannot be very large. So that is the only thing. Now, when you open the Bazaar stats in your Google, so these are the tools which are available there, because you have a number of tools available here. And the ordinal data also is possible here. So various ordinal data analysis can be made here. So this is very handy software as far as I am concerned. So you can try to if you really feel that. Now I'm starting with univariate analysis, that is the study of one variable. Now we use descriptive statistics for summarizing the data. Now they are actually the central value and the dispersion value. Now what is a central value? Actually, a good number of observations are found around this value, and this value is taken as the representative value, or we consider that as a commonly found value in the data. So that is important. So this is the reason why we are going for the central value. So suppose your central value is 26.8 units. Now 26 point units will be used to describe the data. So why we go for this is to only know the commonly found value, because using that only we are trying to describe our data. Now the averages are actually measures to get the central value. You can use a arithmetic mean, median, mode, and all. But see, most commonly, some people or some students actually make mistakes. They consider arithmetic mean as they consider average. So arithmetic mean also they say average. So it is not like that. Average is a common name. So and the different averages are mean, median, mode, and then the geometric mean and harmonic mean. Now the dispersion. So this is again an important measure which we require. And what is dispersion? It is showing it will show the variability or deviation of the data from any average. So here any average is dispersion. When you take the variability from arithmetic mean, and that will be the standard deviation. That is the only difference. Okay. Now, when the spread is too large, then the average calculated cannot be taken as the representative of the distributions. So the data, such data will be unreliable. And then when you consider standard deviation, I told you standard deviation is nothing but dispersion or variability from arithmetic mean. Okay, not from any average. Now when you consider standard deviation, you can see two types of formula like this. One is now divisor by n like this. So it is called a descriptive standard deviation, and then it gives the estimate of sigma. And what is sigma? It is nothing but the population standard deviation. So when you want to estimate the population standard deviation, and if your sample size is large, and what large samples means? Sample size will be greater than 30 are called a large sample. So when you use a large sample, this divisor by n is used to estimate the population parameter sigma, that is the population standard deviation sigma. And now this, students, please kindly note this. This is the easiest formula for you to get the standard deviation, and please don't try to use this, because you can make errors, and mostly when you are using the calculators, this formula will be always better for you. Now we call that yes, because the calculations are made on this particular formula, so I am just making that as a yes. Now another formula, the divisor is n-1 here, and it is known as inference standard deviation. Now when your sample size is small, that is if it is less than 30, and when you are trying to estimate the parameter value sigma, that is the population value sigma, and the divisor is actually n-1, I will tell you what is this n-1, that is known as the degrees of freedom. Okay, so two types of standard deviation formula available, and this inference standard deviation is normally given whenever you use a software. Okay, but what we require is standard error. So this is what I would like to tell all. in dissertation and publication, we make the table normally using mean and standard deviation. But I would suggest you to take the mean and standard error. So it is because the standard deviation explains only variability in the data collected. And now providing standard error that help the readers know the interval in which the population parameter is expected to fall with a confidence level 95% and or 99%, and that is known as the confidence level, because that is also important, because the reader will have to assess where the population value will come from, the data value you give. So always better go for the standard error, because the standard error measurement, if you give, you can calculate the confidence interval easily. And now mean plus minus standard error into 1.96. So that will give you the approximately 95% confidence interval. If you multiply standard error by 2.58, then if you plus and minus, then that particular interval will be the 99% confidence interval. So this advantage is there. So if you provide SD, so this advantage is lost. So just please think about it when you present the data. Kindly use the standard error. That will be a better representation of the data. Now, what is standard error? Standard error is nothing but just standard deviation of a set of statistic values. And the statistic values are what? The X bar, that is the arithmetic mean of a sample. So if you take, if you have say 25 samples with you, for every sample you can calculate the mean value. Now take the mean value as a variable. So when you calculate the standard deviation of the set of mean values, that is actually the standard error. So standard deviation of a set of statistic values. Okay. So for example, a set of mean values. So that is in fact the standard error. So please do not confuse again, because it is nothing but standard deviation of a set of statistic values. And statistic is what? They are actually the values in the sample. Parameters are values in the population. Statistic, the S is not there. Statistic, actually, they are values in the sample. Using the statistic values, we are estimating the population parameter. Okay. Now this software I have used here, and then I have written the result there. So that will give you the mean, standard deviation, standard error, and the confidence interval of the data. Very simple only. This is for you in a calculator. You can do it. Suppose you have a measurements like this. You open the wizardstats.net, and then you can use the 90.95 and the 0.99 confidence interval for the estimated mean of a population in this t-test and procedures. I showed you that t-test and procedures in the beginning itself in that, because I just rushed through that. So you can just, this is very simple. If you open and then do it, then this will be the results that is displayed there. This is the results that is displayed. Okay, and then the confidence intervals also it is given. Now see how the confidence interval is calculated here. This 1.9186 in fact. So it is multiplied, that is this standard error 0.8721 is multiplied by this t value, because this is a small sample, should not. So the statistic is taken, the t value is taken from the student's t table. So if you multiply this standard error 0.8721 by 2.2, then this 1.9186 is what. So that is why I am telling you, please provide the standard error, because for a reader it will be very easy for getting the confidence interval for the population. Now, if you are going to consider the standard error, So whether you use descriptive standard deviation or inference standard deviation, if you calculate standard error, that will be same only. So that is another reason I am just suggesting you to use the standard error. And if you provide the inference standard deviation, and that will not be exactly giving you the information about the confidence interval. Okay, right. Now, this is another analysis we usually take, a bivariate analysis, that is study of two variables. Now, very often, two types of measurements are taken from an individual or a specimen. So therefore, we have a pair of observations. So it is important because the observation is a pair. So when you calculate the number n, so you have to count how many pairs are there in your data. So that is important. And then when you consider the analysis of pairs of data, then two types of analysis you can make. One is the correlation analysis. And what is that correlation analysis will give? That will give you the strength of linear association. This is very important. We are getting the strength of linear association there. And that is actually the Pearson correlation coefficient. Now the next analysis will be regression analysis. And then again understand this is finding how one variable is affected by the other. So there again we get only the linear regression equation there. And then in regression studies, this is very, very important because you have to choose the variables properly. Okay, so whenever you have two variables, one will be the cost variable always. One will be the cost variable, and the cost variable will give the symbol x, and that is independent variable. And because of that particular cost, another variable is affected. So the affected variable, and that is given the symbol y, and it is the dependent variable. So this particular thing you have to consider, and it is very important. So the cost variable should be given the x symbol, affected variable should be given the y symbol. So this is a very important aspect when you are going for the regression studies. Now the general form of the linear equation, because it is y equals b multiplied by x plus or minus, because a will be sometimes negative like that. Now what is b in this particular equation? So that also is very important to understand. Y equals b. So b actually is called the regression coefficient. It is called the regression coefficient. And what is the regression coefficient? It is actually the rate of growth in y for a unit change in x. When x changes by 1 unit, y changes by b units. So that is the regression coefficient. It is also known as slope or growth, all same only. And now a, actually this is the y-intercept. And what is y-intercept? The value of y when x is 0. Now here again I have just given an example. This is very easy if you just can do it in this Bazaar stats. Now the data sample is given here. Now when you just put it here, the correlation and regression, that is the option. And there is a sub-option there, basic linear correlation and regression. And this direct and regression is there. So when you substitute the values, it will give the results like this. So the mean of x, mean of y, standard deviation, standard error, everything you can get there. R, see this you can see many often capital R is given and R square. So please don't take that it is a multiple correlation coefficient, because in softwares instead of the small r they give capital R and here capital R square. But in fact it is small r and R square. But in system such changes are made. Okay, now R square is very important for us. See, what is the benefit of R square? So here, R is 0.53, and the square of that will be 0.281. So you multiply that R square value by 100, so it will be 28% clearly. So that percentage shows that only 28% of the data values, they are helping to find this equation. That's all. All the other data points are not for this. So what can we understand from this R square into 100? How many data points show association actually? So this R square value should be greater, then only we can say that there is a significant association between the two variables. Okay. Now the R value test is done here, and then for in the R value test, one P value is given like this. So I will explain it soon after this one, how to infer when you get the P values. Okay. So the P value actually, it is greater than 0.05. So we say that R is not significant. And so this is the inference you have to write. Therefore, no significant association between age and glucose level. Okay, if R is significant, then you have to give the regression equation like this. And when you provide a regression equation like this, so you provide the name of the variable here. You have to provide the name of, so Y is glucose level, and so you have to pick one X is missing there, sorry. So 0.385X plus 65.14 is there. So in place of X, you have to give the age. So that is how you have to represent the regression equation. So here I have given that R square, what is the meaning of that? R square actually coefficient of determination. So this value multiplied by 100 shows the percentage of data points satisfying the association in the data. So R square into 100 should be nearly 80 or more than percent. If it is there, then you can be confident that there is an association. And of course, this P value will give you how to infer whether the association is there or not. That is here, what is tested, R is greater than 0, significantly greater than 0. That is the test conducted here. And now this, please remember, I told you, how to use the p-values for significance. So these are the three cases which may be occurring in our data analysis. Where whatever be the data analysis you do, using any softwares that will give you the p-value. Okay, so if you check whether the p-value is greater than 0.05. If the p-value there is greater than 0.05, then we have to say that there is no significant the value, whether R or T or F, whatever it may be, that is not significant. Whenever you find a p-value which is greater than 0.05, whenever you get the output. Now see the output here. Here it is 0.2796, is it not? So whenever you find a value like this 0.2796, you have to just come here, see these three options where it is coming. So it will be either in 1 or 2 or 3. That is the thing. So in this particular case, it is coming under 1 only. So the P displayed in the output is greater than 0.05. So we say if we are testing R, then R is not significant. If we are doing a T test, then the T is not significant. If we are doing the F test, the F is not significant, like that. So sometimes what happens is that the p-value will be less than 0.05, but it will be greater than 0.01. There we have to write the significant, but this is what you have to write there. This is what you have to write there. Significant, probability less than 0.05. And this is another option, because in the output, the P will be less than 0.01. So there again, we have to write significant, but see the P, how it is written, P less than 0.01. That is what you have to write. So either it will be greater than 0.05 or P less than 0.05. If your values are, P values are less than 0.05 or 0.01. And then the third option, sometimes the p-value will be still less than 0.01. So the p-value, when you write the inference, you have to write like this. Now, tests of significance, now we consider the large samples. Large samples are n greater than or equal to 30. And I have to tell you one thing is that whenever you use an software, any software, it considers only the small sample cases. So slight differences may come, that's all. Okay. So whenever the sample size is large, then you have to conduct the Z tests, because the large sample data probably will follow the normal distribution, and different Z tests, mostly for research Z tests are very rare only. So the different Z tests, actually one sample mean test, two sample independent sample means, then the paired sample, then the proportion, one sample proportion, two samples proportion, all these are possible. And then when you consider small sample, that is n less than 30, mostly we will have an opportunity for this only. Small samples only normally comes, not in all cases in biological side I am telling. So there we conduct the t-test there. Okay, t-tests are conducted there because they follow the Student's t-distribution. And there again, the most frequently used is one sample mean test. Not always. This is the two sample t-test we are always using. And in particular occasions, now in this nursing and other field, the paired sample test also is done. Now this is a thing which I want to make you understand what is the degrees of freedom, because normally the concept is not followed well. Okay, so I am explaining that here. Now here, population values, once again I am telling you, population values are known as parameters, and the examples are mean is mu and standard deviation is sigma. So these are normally unknown, and they are estimated upon the number of observations n in the data. Okay. Now sample mean x bar and the sample standard deviation capital S, they are known as statistic. So parameters are estimated from statistic. Okay. So when estimations are done, so what is degrees of freedom? The number of independent data values used to estimate a parameter. Understand that? The number of independent data values used to estimate a parameter is called the degrees of freedom, that is DF. So what is the DF? DF will be total observations minus the number of parameters used in the intermediate steps in the estimation of the parameter. So why I am telling you that, see, suppose you are estimating the standard deviation. So when you are trying to estimate the standard deviation, you have to estimate the arithmetic mean of the population. So one parameter is estimated already, and as a second step, you are estimating the standard deviation of the parameter standard deviation. So there, that one parameter which is already estimated is subtracted. So we have only n-1 freedom to estimate the standard deviation. Okay, so this is a simple concept only. Okay, so since it is computed from n random scores minus 1, the parameter mean estimated in the intermediate step. That is why this is divided by n minus 1. That is why this is n minus 1. So that is actually our inference standard deviation. So this particular denominator n minus 1 is the degrees of freedom. Just for example, like this, if you are estimating other things, then it will be changing. Now I have given an example of a two sample test. So this is the sample data which I have used. And now see, the option you have to take is t-tests and procedures, and then the sub-option in that will be two sample t-tests for independent and correlated samples. Here we are using independent samples only, so you have to click on the independent t-test. There will be two options there. One will be independent, the other one will be correlated. Correlated samples we use for paired test. Independent we use for the independent sample test. Okay. And now Bazaar will give you results like this. So here the A value, the set A, how many observations are there? Set B, how many observations are there? You get the sum of x and sum of x squared, you get the mean value. So these are the two mean values for I'm sorry, the power. Are you able to view the screen?
Yes, sir.
Yeah. So here, the mean value of the two groups, group A and group B, also given. Now, what we have test in the test, we have the t value here given. So t value, whenever it is negative, we can take it as a positive only, because t value always absolute value of t is taken. We discard the negative value. And now p value also is given. See, here in any software you can see the two messages like this: one-tailed and two-tailed p values. So you have to, as a researcher, you have to find out what is your alternate hypothesis. So I have given an example here. See, I have taken the null hypothesis. Suppose we are taking two food types, food type A and food type B, and then we are feeding the animals. Okay, so when you just find out the growth or something like that, you got 551.69 growth in A. And example only, 557.5 growth in B. And now, before you start the experiment, you have to give the null hypothesis. So normally the null hypothesis will be the equals only. That is, both the mean values are same. That is the null hypothesis. Now the alternate hypothesis, the experimenter will have to design. If you are sure that A has to be, or A will be giving you more growth than B, probably you have done a pilot study or something like that. So in that particular case, you want to test whether mean of A is greater than mean of B. So as per that, you have to select 1, 2, or 3 as your alternate hypothesis. If you have no idea what will be the growth, then the two-tailed alternative you have to take, because you want to know whether the mean values changes or not, whether the mean values are different. Check. I'm sorry again.
So we can see your slides, sir. You can move on.
Yeah, because the power broke. That is right. No. So the two-tailed alternative we use there, because we do not know what is happening for the both. So we test whether they are different. So the first alternate hypothesis we are using as H1, X bar of A not equal to X bar of B. So that will be a two-tailed test. So if you are sure that A will be greater than B, mean of A will be greater than B, then the third hypothesis you will use. So in both cases, if you are using the one-tailed test, the only one p-value will be there. So depending upon your research hypothesis, so what is your research? What do you want to find out there? So you have to just take the alternate hypothesis as 1 or 2 or 3. So for 2 or 3, it is always one-tailed test only. For 1, it is always two-tailed test. So there will be 2 p-values given there. For a two-tailed test, 1 p-value will be given. For a one-tailed test, 1 p-value will be given. Now here again I am telling you how to make that the 3 is significant or not. Once again, check the p-value there. P-value can be greater than 0.05 or it can be between 0.01 and 0.05 or it can be less than 0.01. So in this particular case, the first option, as I told, it is greater than 0.05, whether it is one-tailed or two-tailed. So you have to write this P is greater than 0.05. The P is not significant, which means that these two mean values are not significantly different. So when you find that they are not significantly different, you have to write the inference as they are almost similar. They are almost similar because there is no substantial significance there. So that is what is just done. So this is very easy for mostly students because teachers will be using the SPSS or things like that. But I will say that the students, this will be very easy in fact. So there two options will be that itself. Sometimes the two sets of values A and B are there, no? There will be a variance. So if the variance are unequal, then it will take one option. T-test is done based on option unequal sample variances. Because this you have to consider, because all the softwares will not take this into consideration. So you have to make the option, but here it will take the option. Okay. So if the sample variance differs significantly, then unequal sample variances it will take. Or if the sample variance do not differ significantly, then equal sample variance option it will take. And then it will give you the. So for testing the variance only, this part is coming under. So this F value, if it is different, then the particular option will be taken, the second option will be taken, and then it will give you the t-test results here. So whatever it may be, so the t-test result, how to interpret that is most important. So check the t-value, check the p-value, and consider whether you are interested in the two-tailed test or one-tailed test, confirm that, and then depending upon the p-value, we will decide whether the p-value is significant or not. If it is significant, then the mean values are really different. So one of the sample mean will be greater than the other sample mean. Otherwise, they will be almost same only if it is not significant. So this is now analysis of variance. So this is commonly used. And now what is analysis of variance? So ANOVA, actually it is in short form, it is used to compare more than 2 sample means or treatment groups. That is most important. So if you have only 2 treatment groups or 2 sets of data, then you cannot do this. You can do only the student test there. Now, how analysis of variance is conducted? It is done by examining the variances of the samples. Okay, so when two sample means are compared, it will be a t-test only. Now, how it is done? So ANOVA allows to determine whether the sample means differ simply due to random errors or differ due to definite systematic treatment. Now I will try to explain this here. Now when you conduct an experiment, normally many factors will be playing part there. So they will have the effect in the final value. So out of these factors, some factors are controllable with the experimenter. Experimenter can control certain factors. But there are many other factors which the experimenter cannot control. But that has got an effect in the final value. So these two factors, so these two effects are to be separated. That is, effect of the controllable factors and effect of the uncontrollable factors. You have to separate. Then only the treatment effect, the true treatment effect can be found out, which the analysis of variance will help you. And then the effect of the uncontrollable factors, we call it as random errors. Random errors or error variation, you call them. So that is separated from the total variation. So from the total variance, we split that into known factors and unknown factors. So that is how the analysis of variance is done. And now one factor ANOVA, I have just given one simple data here. And now I will go to the result only. Now see here again, that will give you the mean of the three samples. The mean value 258, 246 and 210. Now this ANOVA summary is there that will give the F values and the P value here. See here, what is the P value? What is the P value? Definitely it is in the range 0.05 and 0.01. Right now. So that is showing a significance. So don't confuse here because this is very easy for you. So now F is significant and you are going to write the P value, P less than 0.05. So that means F is significant. So what is the inference there? Inference, mean cholesterol values differ significantly between the doses administered. But you see, people will just look here only. Now there is an additional factor which is called the 2K test or the Duncan test, normally done in some case. Now this particular thing will, software will do 2K test only, and now see, it will give you the result like this. It will give you the result like this. So you can know dose 1 and dose 2, they are not different. Dose 1 and dose 3 slightly different, and dose 2 and dose 3 non-significant. So when you have this result, now from this you can infer that doses 1 and 2 are higher and similar compared to dose 3, and which is the least. Now see this one. Now 258, 246, they are almost similar, and then they are higher, and now dose 3 it is 210. So this 2K test, what is that 2K test? The 2K test will help you to find out which of the mean values are different. Which of the mean values are different, and this is called post hoc test. Post hoc test. So this is also available. This is also available in this. So that is what I am telling. And then the 2K test is done in this particular software. So in many other softwares, they may be using the Duncan test or sometimes the 2K test. So this is an advantage for you. So you should not stop with this particular ANOVA. Now here when you find the F value is different, When you find that the F value is different, we will say that the mean cholesterol values are significantly different. But our intention is to convey which of the mean values are better. So 210 better or 258 better or 246 better. So if you want to know that, these differences of these mean values should be attempted and it should be done by the two papers. So that will give a result like that. And now this two-factor with replication. So I'm just taking a few only. Two-factor with replication. So there again, so one particular study conducted the growth in males and females using the high protein and low protein diet. So these are the growth factors given there. Here you have got a two-factor analysis. The protein as factors given in the column, the gender as factors given in the rows, and then the repeated values are here, replications are there. So that is why we just say that ANOVA with replications. So you have to take the option properly, and then when you just do the exam, so the option, so this information as summary you will get, right? Now from there, you have to prepare a table like this, which is easy also. And now the ANOVA result is given here. Now here, this is a two-factor ANOVA. So two main effects will be found here. One is whether there is any differences in the growth between sexes. The other one, whether there is any difference between the proteins. So two types. So that will be known by going through the F and the P value. Now the P value here you see it is less than 0.01. You understand that? So it is written that the P value is less than 0.01. So F is significant. So what the inference is written, mean scores of males and females significantly different. And now here in this particular table, see the males, the total it is 6.5 and females it is 3.5. So we have written male mean score 6.5 is greater than the female mean score 3.5. Now similarly, if you test the difference between the proteins, there again we find that F is significant. There again, what happens here, 6 and 4, see, this high protein, it is 6, and low protein, it is 4. So there is a difference between 6 and 4. So that is given high protein mean 6 is greater than low protein mean 4. And now I would like your attention to this particular. This is actually the interaction. How sex differences are affected by the protein. Okay, that is interaction. So there can be some difference between the sexes in the growth, and whether it depends on the low protein and high protein diet or the treatment. So dependence, whether the sex variation is dependent on the protein. So this test is very important, in fact, that is the interaction, because you have to consider that if there is a sex variation, whether it is dependent on the protein given. So that not significant here. Okay, it is not significant here. So our inference will be mean scores differences between males and females is not dependent on the protein category. So when you consider the protein or high protein or low protein, their differences are not much. So this is the one. 8 and 5. So if taking male, it is 8 and this is 5 in low protein, this is 4 and 3. So if you see the females, the difference is not much. So the sex variation is not dependent on the protein that is given there. Okay, so this is the small idea which I have given. There again, the the QK test results are given here. So this will give you how the differences are significant, to find out how the differences between the means are significant or not. This will be written there. This message will come there. This message will come there, no problem at all. So this will help you to know. See, it is written. If rho effect is significant, between column means only, here the HST stress between rho means it can be meaningfully performed only if the rho effect is significant. So rho effect is significant here, is it no? Similarly, column between column means only if the column effect is significant. And see the last one, and between the cell means only if the interaction is significant. So if the interaction is significant, then we can confidently say that the low protein and high protein have separate effect on the sexes, the male and female. So very easy only, because especially for students, I will suggest you to go to this bazaar stats. Okay. So thank you for patiently listening to me. Now, if you require to clear any doubt now, please.
Thank you, sir. Now the session is open for discussion. Dear delegates, if you have any queries, you can raise.
Now, don't think that you can access me anytime you want, because I'm not that busy. So for any doubts, if you want to clear, then you can even call me, and then I will just give you the details, the doubts clearing. And if you want this bazaar stats, how to do that, I can share you a write-up how to use or how to do this statistical data analysis using this bazaar stats. It also I can just do.
Thank you, sir, for the informative session.
Yeah.
With this, we have come to the end of day 2 UGC Stride 6 days online training and research ethics. Dear delegates, kindly fill the feedback form which is posted in the chat room. Thank you all for joining us.
And thank you so much for giving me an opportunity on the organize this. Okay, shall I conclude, right?
Yes, sir.
Thank you. Thank you very much.
Yes, sir. Thank you, sir. Dear delegates, kindly fill the feedback form which is posted in the chat box.